groups you are around, I think overall therapy can be a positive. My experience with therapy has been that, at least contemporarily, a lot of therapists practice narrative therapy, which I am not a big fan of. I've found that the therapists I've had failed to challenge me and instead were overly validating me. And I believe that that in particular is something that um, therapy culture, at least within the realm that I've seen it, should improve upon.
Okay. Well, thank you for being here. We'll see how it goes. Last but certainly not least, no stranger to my show. Ali, go ahead.
What's up, guys? Thank you for having me, Wick. Therapy good because it helps you solve, a lot of problems that you might be going through and dealing with, and it's a good, good to have someone to bounce things off of that's unbiased, third party. Therapy culture is horrible. It no one actually goes to therapy when in therapy culture. They just read headlines and they get definitions for words and just use those to kind of like cope or get to project their own insecurities onto people, and then under the guise of like, oh well, I do therapy, I self therapize. And so therapy is very good. Therapy culture horrible. Plus it floods. Like, it's already hard enough to find a good therapist without everyone trying to find the same therapist, like much less people who don't need it. But yeah.
I'm curious about that. People who don't need it. Can you
Yeah.
elaborate on that?
Um, I don't think every single person needs a therapist. I think there are people who are going through things and it's good to work them out with a therapist. But to say that, like, just the average person who doesn't have this, like, immense amounts of trauma or something that they're like, why would they go to therapy? What are they benefiting from it? And then it's just taking away from people who do need the therapy.
Uh,
Mm.
I well, so I would so there's I think a valid question there in terms of like limited resources, in terms of like, yeah, can the system accommodate everyone going to therapy? Probably not, or almost certainly not. Even just based off what we know now, there's always a shortage of qualified mental health professionals. But I think the question of whether or not everyone needs it, like, sure, that's probably undoubtedly true. I would wonder if you take the same approach of, let's say, going to the gym and taking care of your overall health.
Does everyone need to go to the gym specifically? No.
Or what about just being physically active?
Yeah, everyone should
I'd
be
argue
physically active.
being physically active is a much broader uh, thing than specifically going to talk therapy, right? And I think we can gain similar
Correct.
benefits from therapy if you're not really
Well,
struggling, from other things, philosophy, from having close friendships and relationships. But I would say that if you are truly, I feel that the people who actually do need therapy, who are really, really struggling, um, will probably have a much harder time navigating the system as it is now. And a lot of therapists, I think, aren't really qualified and or experienced with vast amounts of trauma or have the expertise to deal with it. At least that's what I've found.
well,
Well, that's kind
oh,
of a crazy thing to say. Can I just get a clarifying from what's your Ali? Is
Yeah.
it? You
Yeah.
say need therapy. What does need mean? Do you think that everybody could benefit from therapy?
Yeah. So the immediate need for therapy. So if I remember when I was younger, I was going through a quite depressive era. I was dealing with a lot of panic attacks I had never been used to. So like one day, I don't deal with anxiety at all, and then one day I have a panic attack, and now I'm having panic attacks every day, right?
Oof.
And the first thing I tried to do was like call my doctor. The doctor just goes, "Well, you need to find a therapist." So they recommend you therapists, but then I call the therapist, and they're like, "Well, okay, we'll schedule you for 2 months from now." That does nothing for me, right? And it's so I feel like there are a lot of people who aren't going through things that they need immediately, right? And then they're kind of just using therapy because the culture around it is that everyone should be in therapy if you can get therapy, and then that is blocking people who actually quote unquote like need it.
well, a follow up.
Mm.
Mhm.
In your let's say slightly more ideal world, do you think everyone should have a family physician?
Should have a like it's recommended, sure, but like
I'm just saying, was that like, do you think that's a step forward in terms of progress? As in, everyone has access to a family doctor or general practitioner.
yes.
Okay. Do you think everyone should do annual or whatever semi-annual checkups at a family physician, or you should only go when you have a heart attack?
I mean, yeah, you probably should go. Do a lot of people go? No, but you probably should go. Yeah.
So do you think there's something
It's
to be
good.
said for like in terms of prevention, in terms of especially when it comes to well mental health and physical health? I don't think there's much of a distinction there. But do you think a better approach is something proactive and preventative as opposed to well now I have an issue that needs to be addressed immediately and I need to react?
I understand that you can learn coping mechanisms before you need them, but to say that you need to be in like weekly therapy or
I never
like
said
yeah,
that.
yeah. So like no, I don't think I think you can benefit from it. Sure. Do I think everyone needs it? No.
Just as I would never say, just as I'm sure you would agree that, just as you said, everyone needs a family doctor, but they don't need to go weekly or even monthly.
Yeah.
You'd probably say maybe bare minimum annual, every 2 years, every two to
Yeah.
3 years.
Twice a year, once a year. Yeah.
Yeah, sure.
Um,
Why can you not make the same argument for like maybe every 6 months or an annual sort of like maybe just a screening, some sort of preventative measure,
I
that type of approach,
could. I just don't
as
think people. I
as
just don't
opposed
think
to
people do
now
that.
my depression is
Well,
like making me
yeah,
you know.
I wanna just center this and just kind of let remind everyone we're talking about the culture, right?
Mhm.
As well as therapy in and of itself. And at least for me, my experience with the culture is when we talk about therapy, they're not talking about in general going once or twice a year. They're
Being
talking
yeah.
about going on a regular basis, either weekly, bi-monthly, um, a very consistent
Consistent.
time frame. And I think that there is something to be said. Is this simply like acting as a placebo? Are we using I go to therapy as an excuse not to actually fix our shit?
Yeah, I mean, there was also like a culture of like if he's not in therapy, it's a red flag, just implying that if someone isn't in therapy, that there's an issue with them for that reason as well. So it's like, yeah, it's a weird thing.
Yeah,
Um,
there was that Jubilee video. I forget what it was. It was one of the dating ones, but the um girls, they were young people. They removed one of the candidates because he didn't believe that everybody needed therapy. But I think even the bigger issue with therapy culture is I think the misuse of diagnostic terms, but still treating them as diagnostic terms. So calling people narcissists, but not just like in a casual way, but this person is a narcissist, therefore we must this, and this. This person is a gaslighter, therefore we must, ostracize them from the group, etc. And just kind of the misuse of these clinical terms and giving them the same weight but when laymen use them, if that makes sense. So the laymen that are using them in the therapy culture are giving themselves the weight to be able to put these terms upon people. Like if someone's just lying, suddenly they're a gaslighter when you
there,
could just say they lied.
there's two sides of this therapy culture coin. There's still, granted, a much older, kind of dying out culture of thinking that if you go to therapy, there must be something like wrong with you. This person is like they're like a danger or something. There's a lot of people who won't seek therapy because they don't want to be seen that way. Granted, this tends to be older people, but I'm really curious as to how that relates to why did you go to your doctor when you were having anxiety? Because I think that most people nowadays would understand if I'm having bad anxiety, this is in the realm of mental health, not physical health, but you reached out to your doctor. And I think that's a
Mhm.
really interesting, uh, like tell to how you think about your mental health. Why was that?
Well, because I tried calling a therapist or like therapist office, and that's like
Oh, that
I
happened
just
first, and then you called your doctor?
no, I had a panic attack. I looked up therapist. Like I asked people what should do. So they like I looked up therapist, and then I couldn't get into the therapist because it was such a long wait time. Like I called two or three of them, so I
Mhm.
figured my doctor would be able to recommend me therapists that I could go to. Plus, they already know my insurance and they have like my history, so I figured they'd be able to better like prescribe a doctor if that makes sense.
Sure. And do you think that if the system that, sort of Corey was implying to lay out, that if we had like a therapist that we could touch base with every 6 months or annually or something like that, if you already had that established because it's something that would be, regularly sort of like in your life, if not just in the peripheral, you would have had a much easier time setting up a more immediate appointment with a therapist, and
I
you
mean,
wouldn't
yeah,
have to go through that.
I wouldn't be opposed to that, but that's not what the issue is. I have no problem with people like having therapists or like even everyone going to therapy, But like
Sure.
it's just the problem is the culture of it is that everyone should go to therapy once a week. You should have a regular, or like at the very least get BetterHelp. Like BetterHelp is a advertised thing which I think it's actually not good, right? Like I don't think I've heard a lot of negative things
I
about
can
BetterHelp.
I
I
can't
don't
say.
have any. Yeah, so it's just like we're getting to the point where it's like, yeah, just FaceTime this person. And if they're not good, you can find another one within a week. And it's like I feel like these people aren't the most qualified people if they're on BetterHelp.
Do you know that? Is that like, is
I,
it
I, I
just your
don't. I
feeling?
don't. It is a feeling I have because it's just like I feel like if you are a qualified and good enough therapist, that you wouldn't be on like BetterHelp.
Has been some evidence that,
I don't know about that.
at least in the past, that with BetterHelp, some of the therapists on there weren't actually licensed to practice. So there has been that controversy. I don't know too much about it, but that has been a thing that's been in discussion like the past couple of years. But to go back on the therapy culture topic, I think that the therapy culture is almost informing. At least in the US, I don't know how it is in other places, but I think the therapy culture is informing how therapists practice. And like I mentioned, like a lot of therapists I found practice narrative therapy, which is very validating to the patients.
Can
And I
you
think that,
just
oh,
I hate to interrupt, but just for the
yes,
sake of my audience, right? Can you briefly explain what narrative therapy is? Because they
sure.
hear that term, they be like, what are you talking about? Go ahead.
So, in short, narrative therapy is kind of about you telling yourself your life story, and it's it's like a form of talk therapy. Again, I have kind of seen it practiced clinically, but I switched over to EMDR with my therapist, which is eye movement reprocessing and desensitization, which helped me. But narrative therapy, to me, I think is not challenging enough because it is validating your life to you, in my opinion, instead of challenging you. So
Well, you're
telling
not
a
really
story with
explaining
you
what
as
it
the main
is.
character.
That's
It's
not
it
really. So just to be clear, narrative therapy is counseling. It is talk therapy, which is what most people are talking about when they say therapy, which you evaluate your problems as something that's separate from you. You don't, it's a way to get somebody to not identify themselves as their problems. So it's something that they can approach instead of having to conquer like themselves. So it's sort of like a step in the direction of getting the healing. It's a way to get an understanding of what your core beliefs are and how they might have led to these problems that are also not you. I think that's just a really weird frame to put that in. It feels a little dishonest when you word it like that.
you explained it better. My
Okay.
apologies. I definitely like I was like I'm trying to remember because I was actually applying to initially I thought I wanted to be a therapist, not anymore. But when I was looking into programs, a lot of them were teaching people how to practice narrative therapy versus, really psychoanalyzing. But yeah, I'm just personally not a fan having
Well,
experienced it. But I think that the therapy culture is pushing therapists to more so validate than challenge their clients, which I think is the bigger problem. And saying basically, like, if somebody comes in and says, this person is a whatever, blah, 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 the therapist will say, oh, that's, how you feel. And
well, I'm just curious. So I am not a mental health professional at all in any capacity whatsoever, even though Dr. K literally steals my talking points. But regardless, how did you know that? So there, just as there are bad doctors, there are bad therapists, there are bad professionals in any professional setting. But how did you know that this is not the treatment for me? How did you know that this I need these treatment guidelines as opposed to what you were encountering?
I had a very specific thing that I was dealing with. They were specific traumas. I did read the famous book, The Body Keeps the Score. It's a really great book. I really like Dr. Vander Kolk's work. And in it, he discussed EMDR. I asked my therapist if she practiced it. Luckily, she did. After about 6 months of regular talk therapy, narrative therapy, I asked if we could switch over to EMDR, and we did. What really made me feel that narrative therapy wasn't helping me is that it wasn't challenging me enough. It wasn't giving me what I needed.
Okay, but
The
well, how
therapist
did
would basically validate
well
me. Any problem I'd come with, they'd be like, yes, that makes sense. They wouldn't tell me, here's where you're going wrong. And I'd do my
okay.
best to present
Well, so without
all
getting into
sides.
well, thank you for sharing, but I don't want to dissect your treatment experiences, but I'm just curious, trying to contrast it, so again, these are whatever mental health professionals, arguably medical professionals. So how are you by what criteria are you rejecting these sort of treatment guidelines? As in uh, you know, how do you know that they weren't just following evidence-based treatment guidelines, and that you want to go off the evidence-based treatment guidelines?
That's a good question. I think it just felt like a conversation I would have with a friend. I would say the most helpful therapy I've gotten was back in university, through the university therapists. That therapist really challenged me. The two therapists I've had after that did not, until the one I did with EMDR, and then I tried another therapist after my insurance changed, so I had to switch therapists. And it just felt like they were there almost to have a conversation with me versus to make me think different, like give a different perspective on my situation.
Again, without getting personal, but this is somewhat analogous to like, I've never had cancer. Hopefully I never do. But like, this is analogous, like, if I'm receiving chemotherapy, well, I just know off the bat, this is not treatment free. I know that I need this. But how do you know that they're your doctor? It's good to question them and make sure that they're, you're getting, appropriate treatment. But how do you know that you're just not rejecting something that's actually good for you? You just don't know it yet.
So here's what I'll say though, is that when I did say, hey, can we do EMDR? She said yes. It feels very patient-led. If my therapist instead said, no, you're not ready for that, we are continuing with narrative therapy, I would have then felt challenged. That would have been what I came to do in therapy, right? But therapy does feel like it is very patient-led. Like you do kind of, if you want to find a CBT practitioner, you can go ahead and do that. If you want to find a DBT. I don't know.
So this is really crazy
Ollie.
to me.
Yeah, Drazi, then Ollie. That's the order we'll go in. Go ahead, Drazi.
Okay, so my last therapist, I thought she was incredible, and if I didn't like something, I could say, "Hey, I don't want this to come back up again. I don't want to deal with this thing." And she can say, "Okay," and I would ask, like, "Well, why is that okay?" Because I want to understand my treatment. Just like if I'm seeing a doctor, say, "Why are you putting me on this medicine instead of this medicine?" Can you just explain it to me so that I feel comfortable? I want to understand. And she explained to me that you want a patient to be a participant. You don't want them to be somebody that you're forcing along with it. So in order to receive the benefits of therapy, you have to be a participating member. And because therapists, until they really get to know you, they do have to use like a broadly applicable approach. Once they get to know you, they can start to narrow it down and find which things are going to be really good for you. But the number one thing they need is that they need you to be an active, willing participant. So they're going to have to bend certain things that might be the best thing that ultimately for you. But in order to determine that, they're going to need you to be willfully actively participating. Like you need to be invested in it. One of the best things anybody ever told me about therapy is finding a way to pay for therapy is part of therapy. And I thought about that. That means that if I say I'm not going to go to therapy because I can't afford it, that means that I'm not willing to bet on myself. When I came up with $200 for that initial visit, I'm saying I'm going to bet $200 that I can get better. I'm going to put this money down and say I'm betting on myself that this $200 in me being a better version of myself is going to be worth it. And that, I think, is a great way to get yourself in the mindset of being a good, active participant in your own therapy. And so I think you need to cut your therapist a break. You have to like them at least a little.
If you want to bet on yourself, donate to WIC TV. Bet $5, not $200. Well, you can if you want, but $5. You will bet on yourself. You may win, you may lose. I don't know, right? Well, I can't
Sorry,
say.
Wick, I don't feel like you challenged me enough. Just kidding.
But I want to toss the ball to Ollie for a minute. Go ahead.
Yeah, so I mean, Drazi, I want to address that. I don't like the idea of like making it so that the person isn't betting on themselves because they don't have the $200 to put up on the initial front, because it's not just a $200 initial front. You typically, once again, with the culture of therapy, it's like recommended that you go weekly. And that's how people have it approached. And then I'm so sorry, can't remember your name. It was Amina?
Arena.
Okay, so one letter off. Cool. What you brought up was kind of like my issue with therapy culture, and I'm to Drazi's point too. So it's the same thing with like medical culture becoming so like popular. People would look up their ailments and then they would go to doctors and they would go, "Hey, this is my issue. This is how I want to be treated." Right. And so because they felt like they were informed and they could look up things and they're within the culture. My friends are doctors, so on and so forth, or my friends are in med school, so on and so forth. they would go to doctors with their own ailments, what prescriptions they want, and how they want what treatment they want. And I think that's the same thing that's happening with like therapy too, right? Is like people have looked up so many different types of therapies they like, dislike, that they're going to therapists with their own plan of how they want to be therapized, and it's just like that's not how that works. Like it's like you already did the therapy at that point.
Yeah,
This is
that's why I asked the question of like again without getting too personal, like how was Arena like what criteria are they doing to reject it? Like
I know
recognize
I know what you did.
I
Yeah.
recognize that there are bad doctors, and as a patient, myself, like you should advocate for yourself, but it's a fine line to use maybe a loose example of like Trump and their legal approach of like there's a point of like questioning your lawyers, okay, and there's a point of
We'll
like
see
getting a
how
second
this
opinion.
metaphor goes. Go
But
ahead. I'm
but
curious.
if you're rejecting every single piece of legal advice until you find the one that matches what you want, then that is a problem. I think that's a recognizable problem. Like, yeah, I'll reject all the 10 lawyers that are telling me the same thing until I find the 11th that just happens to give me what I want. If that's your approach to therapy, I don't think that's good, but I'm not really qualified personally.
But that's how
to make-
we're talking about the culture, and at least from what I can see of the culture, that's what everyone is told to do. Shop around for your therapist, right? Find one that works for you, quote unquote, right? It's all about like never being told no in a very real way. Like
So
never
to
being
flip it
told
around,
you don't have this.
Yeah.
Because I've heard people like, oh, I know I have ADHD. I know I do. And they will find a therapist that will tell them yes. And you have this incentive structure, especially in America, an incentive structure where the therapist who will tell you yes get money.
They're not looking
Right?
for therapists, they're looking for copium dealers. That's all they're looking for.
Yeah,
Yep.
but you would probably never advocate of like, if you happen to know someone that, they went to their doctor or whatever, and they received a cancer diagnosis. You probably wouldn't advocate for them to like shop around until, you get that false negative. Like until the mistake is made, that like, yeah, they don't actually detect it.
So
Shop
like-
around though, but you can get like a second opinion, which is
I said that earlier,
Yeah,
but if
yeah.
you're getting
Oh, yeah.
if you're getting a fifth until you get the one that you want, like
That's
that's a
bad.
problem.
yeah.
This-
That's
this
why I was
is-
like asking the question.
this is a big problem with therapy culture. But I think it still stems from you're not really being an active participant in getting better. You're being an active participant in finding somebody to tell you that, hey, you're right. You know what? When everybody tells you all these negative things, you're not fucking narcissist. Even what they're saying doesn't even sound like in the same ball field. You're actually just that fucking great. If that's what you're doing, you're not really trying to get therapy. You're trying to get
See,
somebody to jack you off. You're looking for a prostitute, okay?
Elder
You just want
Drazi,
somebody
that's
to make you feel
exactly the
good.
problem
That's
I
what we're saying the
encountered
problem
with
is.
my
Hold on,
therapist.
Let's go to Arena, then we'll go to Ollie.
Sorry.
Arena, then
Yeah,
Ollie.
Elder Drazi, what you're describing there, that's the issue I found with my therapist, is they would not challenge me. They would just tell me, you're doing great. Look at you. You have a job. You have a degree. You have this. You have that. And I'm like, okay, but there's all these other things, right? And so that was really the frustrating thing for me, is I wanted to find someone to tell me this is,
You do need to shop a little.
What you
You
need
need
to
to
work.
find comfortable. If you're not comfortable because you're being told yes too much, then sure. But what Corey still stands is that you need to know that you don't know better. When I go to the doctor, I'm a fucking crazy nerd and I'm germophobic, so I do look everything up. I'll go, this is the stuff that it sounded like to me. That if that helps inform you, I know I'm not a doctor, like whatever you say I'm gonna listen to, but like I couldn't help but look stuff up. So there's a bit of humility, even though I am going to like psychopathically look up all of my symptoms. But I also know that I have to respect the professional. And I think that's
of course,
the best kind of
yeah.
approach in the digital age.
I respected that I have no diagnoses or anything like that, and I respected their treatment path for me. And I've graduated from therapy. So it's not the not respecting, it's just that I think the culture as it is needs to challenge patients a bit more rather than just validating them at every turn.
I'm super curious. So seems like people are pushing back on this culture therapy, and to me, use an interesting term or a phrase like you graduated from. I don't know what that means of like graduated from therapy. Of like you got a badge, like you are now mentally well for the rest of your life.
My therapist said that I don't need any more sessions. My therapist said you're doing good. You don't need any more sessions. That's what I mean.
Isn't that the goal? And also, thank you for the gift sub to Testy Johnson, and thank you Testicle Johnson for the $2 to say emotions are dumb and should be hated. Hatred is an emotion too, sir. But yes, yeah, isn't that the goal to graduate, quote unquote?
Yeah.
Well, I'm
Isn't
not
that
a
the goal
mental
to
health.
no longer need the therapy?
Well, again, I'm not a mental professional, and obviously it depends on what type of condition that we're speaking about. But like, yeah, there's something to be said of like the therapist empowering you with the tools to hopefully now bring forward in the rest of your life. Same thing, as let's say my approach as like prior as like a personal trainer. Like, yeah, at some point I would want to empower my clients where they can do things on their own. But I would never say like you've graduated from personal training and you can just stop exercising type of thing. Like you're done. You're now physically healthy. I don't know if it works that way. Pretty sure it doesn't. But
Well,
like, yeah,
I
if you're provided
yeah.
tools that you can carry forward, then yes, that's. But not everyone has that. Not everyone has that experience. That's all I'm trying to highlight.
When I quote unquote graduated from therapy a long time ago when I was younger, the reason my therapist gave me said, "Look, I think that you care enough about your mental health, and I think that you have the tools available to you to guide yourself. And we've worked through all the things that you came here for, and I think that you're going to know how to handle yourself, and that if you need to get back into therapy, you're going to understand when that time is for yourself." So that was me graduating therapy. So if you have somebody to where like if you're a personal trainer and you get there and they've already like done a third of the stuff you're going to have them do, you might be like, did you even need me anymore? Like, you seem like you got this shit down. Like, honestly, you're paying me a lot of money and I have other people that I could be helping. Why don't, like, if you want, why don't you take 2 weeks off and see if you still need the motivation and guidance of a personal trainer? Because if not, like, I think you're nailing this. I think it's kind of like that, right?
Yeah. So what you've outlined, like, I don't disagree with. I'm just like to like bring back in sort of like therapy culture. A lot of people use the term of like, well, I've been to therapy and I've done the work and now book closed, chapter closed. Same thing with like just as I would never take the approach. That's why I try to use the analogy of like physical activity. Of like, yeah, I've done physical activity. No longer need to do it anymore. Uh, like that's just like a bizarre concept to me. It's like just as to maintain your physical health, you need tools and whatever regular practices to incorporate into your life moving forward. I would say the same thing
I'm gonna
holds true with mental health, but many people don't approach it that way. They just say, "I've graduated therapy. I've done my 12 sessions. Now I'm good and set for life." And it's like, well, not my place to, I guess, really
gonna
challenge that. But that seems a little
gonna
sus.
toss it to Ollie for a minute, and then I have a question
Yeah.
that might drive us along a little bit.
Yeah.
Go
so
ahead,
even
Ollie.
so even though I'm pro therapy, I think people, if you're having problems, you should go to therapists and maybe even a little bit of prevention if you want to go once a year, once every 6 months, whatever. Cool, I'm with that. My experience with therapy was absolutely atrocious. I was having panic attacks. I couldn't find a therapist immediately. Then when I when I finally agreed to meeting a therapist, like within the 2 month like period they gave me, waiting period, I had to see a psych first. I saw the psych. I got prescribed SSRIs and benzos, and then I got hooked on on benzos. I didn't take the SSRIs because I didn't want to deal with that because the initial listen, when you're having panic attacks that are debilitating, and then the psych tells you, "Hey, so you're not these might not make you feel great immediately, and if anything, the panic attacks might get worse for the first 6 weeks." I'm not dealing with that. I'm sorry, not
Well,
doing. That's
So I didn't follow the rules. I had a really bad outcome. So therapy wasn't very good for me. Like, what?
No, well, I didn't want to be put on medication. I wanted to just talk therapy.
Well, you
I
still
didn't want
took the
medication.
one medication you did want, and like there
Well,
does seem to be a
yeah,
correlation between depression and
because
your ability to be more susceptible to addiction. So like maybe if you took the thing that would have helped you with your depression, you may not have been as susceptible to having the mental addiction to the benzos, right? Is that
I didn't go.
possible?
No, because I didn't go to the therapist for my depression. I went to the therapist because I was having panic attacks.
I
The benzos that were prescribed band-aided the panic attacks, which allowed me to get through the day. I couldn't, whatever. So I
right.
wasn't, yeah. So
You
I
took
in the
half of the
addiction
medical
factor.
treatment, though.
I
A
understand that.
psychiatrist is also looking out for your mental health. They said, here are 2
True.
medications I want you to take. You're like, well, I'm just going to
I'm
take
not.
this one and not
I'm not.
this one.
I'm not blaming the prescriptions that came
No,
through. I'm saying, like, I
you're
understand.
blaming the process, but you
Well,
didn't follow the process the way that you were supposed to, and then you're turning around and pointing, go like, I had a bad experience here. It sounds like you created a bad experience. You
well,
can't. At the
if you're
very
someone who
least, you
doesn't want to be
can't.
put on medication and you don't want to
Okay,
take medication
but
for a while, but you
okay,
have to take a medication
but
that band-aids your
okay.
ailment,
So
right?
Wait, all I'm saying
I
is
Take
that
the
I
you're
want to
band-aids
address
saying
that
that.
this was the
go
thing
ahead.
that was wrong,
I mean, yeah,
but I
yeah.
also didn't follow through the process the way that I was told to. So all I'm saying is that
Mhm.
it's weird to blame the thing when you didn't even do it. You didn't hold up your end of the bargain. So it's weird to blame your experience with therapy because they made you do something you didn't want to do. You did it. You were told to do something. You only did the part that you wanted to do and said, I had a really bad experience. Maybe you would have had a better experience if you would have followed the process the way it was recommended. And even if not, I don't think you can then turn around and say that it
No,
was that because you didn't do
I
it.
would have just been on SSRIs that I couldn't get off of. That, is also a problem for me.
Well,
I
this
didn't want to
leads
be on
into
the benzos, but the
this
benzos
actually leads
help.
into my
Yeah.
question. This
So, like,
actually leads into
well,
my
I just
question.
want, I know, no, because the way that was painted, absolutely not. So, no, I didn't go to therapy for pills and medications to be treated like that. I wanted to do talk therapy. However, when you're having
Yeah, but
panic attacks, specific help, I didn't want my depression treated with pills. I don't want my panic attacks treated with pills, but I can't get them treated with the talk therapy that I was searching for. So, the only way I can treat the panic attacks that I'm having was with the benzos that then I got hooked to. Has nothing to do with the depression because I got off them without the therapy and with weaning off. So it was like
okay,
it was more of a dependency than an addiction thing.
but the
Okay,
argument is
I know we want to go
I
into.
just
Let
want
me.
I just don't like the way that was
Sure,
framed. But
sure.
yeah.
I will ask the question, and you guys can continue to talk because this bears into it, right? Part of therapy culture is also medication culture, right?
Hmm.
And your experience mirrors the experience of many I have heard from who want to go to therapy but are prescribed pills, right? They feel like they are cast off in a way that well, we don't really have time for you right now, but here's some pills, take these, and we'll kick the can down the road. If they don't work, maybe you can see me later, right?
Hmm.
And I think that this bears into the larger culture of, well, I just of being over medicated, right, for these things.
Uh,
And it's you can't graduate, right? If you are consistently addicted to SSRIs and these other like things like that. So I guess
Oof.
the question would be, do we over medicalize? Yeah, over
medicate.
Medicate.
Over
over
medicate.
prescribe,
medicate. Yeah, or over
over
prescribe.
medicate. Yeah.
Well, yeah. So just to attempt to answer your question and also to address what Ali and Elder Drazi were bringing up of like
Mhm.
uh, I think Ali, I think you were pretty much like, from what I can tell, like doing what I was alluding to earlier, of like you were trying to curate your particular treatment, of like you wanted to reject, like you had a particular idea of like, this is how I want, my medical professional, psychiatrist, assuming if they're prescribing, almost certainly they're a psychiatrist and they're a medical professional. It's almost like going to like, if you have a diagnosis of cancer, I don't want the chemo, I want the crystals. I want some sort of crystal therapy. It's like, well, by what basis are you rejecting what they're recommending to you? Yes, the doctors make mistakes. It totally might have been a mistake. But I think there's what Eldedrazi was bringing up of like, you didn't actually follow the treatment protocol. And then you're surprised, or like, I don't know how you can say that you had a negative experience with a medical professional if you didn't actually follow what they were saying.
My experience with okay, so when someone's seeking therapy, okay, so unless someone is okay, so if I have ADHD, right, and then I'm seeking out a doctor because I want to be prescribed Adderall to fix that thing, there's no problem there. If you have to go find out if you have ADHD first. They're not just gonna prescribe you Adderall. They're gonna find out that you have this thing, probably to see if they can treat it without the Adderall first, hopefully, and throw it. So with my issue was, I didn't want I did not want to be on pills as a treatment for the anxiety that I had. So in my opinion, that's the proper way to think about therapy is I'd like to go see a talk therapist, deal with the issues without medication. But my experience was before I could see the therapist or had to wait 2 months to see the therapist, I got hit with the psych and then I instantly got prescribed Xanax and SSRIs. And it was like, well, I mean, I'll use the Xanax because it's gonna treat the like panic attack that I don't know how to deal with or cope with, or I don't know what to do with these things. I'm waking up and I'm not able to go to work, right?
So
Because it's like,
there's something really important here, and I'm I have to actually be a little bit personal to address what you're saying here.
yeah, go off.
When
I
you
don't
got
care.
prescribed the Xanax, what was the prescription for? Was it to say take this every as needed, no more than every 4 or 6 hours, something like that, or was it
Uh,
or was it take it every so often on these like marks? Because
so
okay, go ahead and answer, and then I have a follow up question to that answer.
it was prescribed to take as needed twice a day, like Yep.
Boom. Okay, so if you had taken an antidepressant alongside this, there is a very good chance that as you're waiting for the SSRIs to build up into your system and become an effective means to stop you from having panic attacks, because depression and anxiety kind of go hand in hand. We're talking like spaghetti and meatballs, peanut butter and jelly. Okay, if you see one, there's probably the other one there. So if you were taking the antidepressants, as you're supposed to, that as needed amount goes down. Your likelihood of getting addicted goes down. And maybe it turns out that you didn't need to be on medication long term. You needed that talk therapy, but you did need something to help you for those 2 months while you were waiting. And if you had followed as prescribed your medical treatment, instead of deciding, I actually know what's best with this medical treatment, I didn't need these SSRIs, I just needed this as the band-aid, you are still making a mistake in thinking that you know better than the doctor, and you are taking a
Obviously.
medication that is, you are increasing your risk of addiction by not taking those SSRIs along with it.
I think, but
It's just-
I
Ollie's,
mean, sure, that. I mean, sure, I never said I was smarter than the therapist or that I knew better or that what
you
I did was the
behaved as though
correct.
you were. And that's what I'm saying. And
That's
then
the problem with the culture that comes with it is people will tend to behave in the way they were. But also, the other problem is a lot of people do not want to be hooked on pills in general. So especially when the side effects of those pills that are thrown at you in the commercials, and if this doesn't work for you for the first 4 weeks, your panic attacks might increase. Not taking that risk when I've never had panic attacks before, and if I only have to wait 2 months to see the therapist, I'm not dealing with 6 weeks of side effects before I see the therapist. So,
yeah, let's
like,
toss it to Arena real quick and see what
I
you
was going to say, I think Ali's experience kind of demonstrates that the people who do really need that psychological help, and I think this is parallel also with people who are very much in the medical system, people with chronic illnesses, people with disabilities, they have a harder time navigating the system, whether it is because of the waiting times, whether it is because of dismissal, or if you are in the state that Ali was describing, maybe you're not in a position to be following a certain protocol without maybe extra guidance or like check-ins from a therapist or psychiatrist. And I think the harder of an issue you come in with, the more likely it is that you're going to encounter those negative experiences because you're just in the system longer. So it's not, I think, that the system period is bad. I just think that the more complex of an issue, the harder it is going to be for the providers to effectively treat and support the patients. And especially, yes, the system is overburdened and underfunded, et cetera, et cetera.
And to to answer the original question, Wick, since again I'm absolutely not a medical or mental health professional in any capacity whatsoever, so I can't say with any confidence about overprescription, over medicated. I don't really see any hard data to point to that. I think it's possible for sure, but I think you have to tease out, or it's hard to distinguish that between like, is it like intentional overprescribing, or is it like maybe Ali, you have the mirror image of Ali. I don't want the talk therapy. I want the medication. Give me the medication. And now they're requesting the medication. That totally happens. So is that, that
there is data to suggest that there's over medication. It was quite a while ago. I think it was roughly a little over 10 years ago. Newsweek came out with a study that showed around 75% of people taking antidepressants did not actually suffer from like a chemical imbalance causing the disease depression. They may have been depressed, but they don't have depression. Now, this is obviously over medication is an issue. We all know somebody who determined themselves that they had ADHD, and they shopped around to find somebody who would give them Adderall. Everybody knows somebody who's done this. If we don't know them, we are them, or like we know somebody who knows them.
I was that one
sure.
with Xanax.
And as somebody who has had like if you've seen me stream, you know I have. It's undebatable. Like you see me go, oh, this guy has ADHD. I was diagnosed like 4 different times by different doctors my whole life, and for a long time I didn't want to take ADHD meds because it made me feel bad about myself. Now as an adult, I realize I don't care how I feel about myself. I have to take my medicine like I'm supposed to so that I can be a functional human being. There's two sides of medication culture. There are people that are insanely against taking medicine as though it's going to put some hex on them. They're walking around with a big sign on the back that says fucking loser, or like I can't deal with life or something. And
Or
there's
they're
people that accuse people of
misdiagnosed.
that. Sure, but I'm talking about the internal sense that people have against medication. Like you said, well, I didn't want to be on pills. Why? Why are you deciding that pills are the wrong answer ahead of time? And then there's the other people who think that I'm going to take as much shit as I can get because like somehow this gives me, if I can hold up a pill bottle and go, look, you can't like I'm allowed to be this kind of way because I'm sick. See, I have my pills. Like there's the both sides of this are insanely destructive to the individual, and it's really bad to society at whole.
I don't
We need
think
to find a
so.
middle ground where we can accept that doctors probably aren't large trying to overprescribe people to line their pockets with money. And at the same time that
Speaking of lining my
maybe we could
pockets with
use
money, $5 from Testicle Johnson to say
meds.
America's most highly prescribed for psychiatric medicines in the world. So
Wait, so then you have problem with you have no problem with pain clinics just prescribing Norcos and Vicodin to people who just have pain instead of telling them to try to deal with their ailments like in a more natural, holistic way first?
No, I don't think many people end up at pain clinics
Arena
as their
had to
first
go for
stop.
about 15 minutes. She'll be back in 15 minutes. Just FYI.
No, well, well,
Yeah,
a lot
a
of people
pain
do.
clinic
And what
is-
I'm saying is, if someone's in pain, do you think their first form of treatment should be go on pills and just be on pills for the pain, or should they try to treat the pain first?
So what this is pretty rare. You don't usually get to, very few insurance companies are going to allow you to walk into a pain clinic as your first stop. Usually if it's your general practitioner, they're going to recommend some stuff. This is how people end up in pain centers. They say, okay,
They were
here's what I need you to do.
Oxy for
You need
headaches at
to,
a point. Like,
okay, anecdotes are anecdotes. What
it's not
generally is going to
anecdotes, but
happen?
what happened in like the entire country. We had an oxy epidemic because doctors were prescribing oxy at like high doses. They were told to prescribe oxy, and the people that had the pain, that whatever, even if they had a slight pain, if they had
Sure.
sciatic pain or
yeah,
whatever,
this was
were hooked.
a
So this is
real
this isn't an
issue.
anecdote.
It was
This is
well
like,
documented.
we have an
It was going
opioid
through the
epidemic in
courts, I
America.
believe.
I understand, and I'm talking about part of this is what happens is say, I have back pain. Doctors say, okay, here's what you need to do. You need to do these stretches 2 or 3 times a day, and come back and see me in about 2 months after you let me know how this is going. Also, you need to not be sitting so much. People go, okay. They come back, go, yep, I did everything you told me to do. They didn't. And then I say, okay, so we're going to look at some options for you. And sometimes people end up at pain centers. Also, part of the problem with the opiates is that everybody, doctors included, were lied to about opiates for a really long time. They were told that they were non-addictive. They're basically seen as miracle drugs. Like, we solved the pain problem, you guys.
So people should be skeptical of the companies that are selling them pills. So therefore, they should kind of be skeptical of like, well, should I be on pills or not? That's kind of like
because
why people are. They
one
don't trust
flavor of
pharmaceutical
medication
companies.
has done this. So then we have to be skeptical of everybody to the same degree, as though it's going to have the same kind of like terrible
When
effects.
you cause
I
an
don't think
epidemic,
so.
yeah. Well, first of all, when
Sure.
you cause an epidemic, 100% you're skeptical of the of the entire pharmaceutical pharmaceutical brand at all.
I don't
All
think
of
that
them.
because of opiates, we need to look at medication that have been around for 30 years and don't
What
seem
about
to be causing
benzos?
people to be dying.
Well, wait, is there any evidence? So as Elder Drazi brought up, like medical professionals like were lied to, hiding like somewhat analogous to what the
about
tobacco
benzos or
industry
over
did.
prescriptions?
Yeah.
Because like over prescriptions of benzos, it's gonna be anecdotes for me all day, and also like every housewife will can probably attest. Fam, I know women that were essentially drug dealers with the amount of benzos they were prescribed. They had jarfuls. Like
Sure,
an
but
I've met them
expensive
too.
When we're
amount.
talking about the oxy issue, when we're talking about the opioids, right, in general,
Oh.
right, I think it's pretty well documented how overprescribed and pushed they were by pharmaceutical companies onto the doctors, right?
Yes.
They were given money to push these drugs and use these drugs and prescribe these drugs in place of other medications, right? There was a lot of financial incentives for them to do so. The pharmaceutical companies did lie to the doctors, but that doesn't change the fact that these doctors did overprescribe them. $10 from Infallible Fowl to say, growing up, they wanted to put me on Ritalin, but my parents were afraid to try it. My grades slipped, and I was a weirdo, so they probably would have helped. Meds aren't for everyone, but some need them.
Yeah. So
So,
I think we can all
if I
agree
may,
that there's
if I may, just
okay.
just real quick, and I'll let you respond to that point. Right? Like, I understand what you're saying about how people should be skeptical and you shouldn't just like trust everyone just out the gate. But there comes a point where you do have to trust, right? Where you do have to say, okay, well, if so many people are telling me I need this drug, maybe I actually do, right? Like we can't just live with constant paranoia.
Facts.
Yeah.
Agreed.
I've also talked to doctors about specifically this, and I've even actually talked to a woman who came from medical research who was headed to a conference with like the United States government leaders over the University of Michigan. They had a conference about it because I was a Lyft driver, so I get to meet interesting people. And one of the things that was like a big focus of this was that doctors seem to be in a position to where if they want to do what's best for their patient and they know that their patient is going to leave and find somebody who will give them the opiates, that they're going to give them the safest doses that they can and still keep their patient while also trying to provide them with the best medical treatment they can. It's sort of a lose-lose for a lot of doctors. They go, I don't want my patient to be on opiates. I don't think they need them, but I know that they're going to leave because they keep pressing the subject. So I'm going to try to do it in the safest way possible.
Yeah. So I know you want to. I'll just build upon what Eldrazi is saying. To use somewhat related example of like it's a no-win situation where people in my opinion United States healthcare is consumer-based healthcare where it's like you get to shop around and like yeah, if you're not satisfied or if you're not getting the exact treatment that you want, you can switch and a good example in my mind, more closely related to my field of like this is a problem with let's say antibiotic resistance, where a lot of people go to the doctors when they have a cold, which is a viral infection, saying, "Hey, I need something for my cold," and well, an antibiotic's not going to do anything for that. But many people have in their mind of like when I go to the doctor, I'm supposed to be prescribed something. So if I come out of that office empty-handed, well, I got bad medical treatment. You might get a bad review. And so many doctors will, like this happens, we overprescribe antibiotics. Like I would say there's a lot of data to back that up. And this is largely driven, or part of it is driven, is because, like, yeah, just to acquiesce or, to satisfy the patient of like, well, I want to get them off my back. Like, yeah, this antibiotic's not going to do anything for your cold. But hey, you want something, so here it is. And I think that happens way too often.
Try vitamin C.
First of all, thank you to Brittany Simon and her viewers. Thank you for tuning in. We're talking about therapy culture and medicalization in America. It's an interesting discussion. Kick your feedback up, take a listen, like the stream, etc. $10 from Artemis Fowl, not to be mistaken from Infallible Fowl. I am looking forward to the second hour and call-ins. Can anyone tell me what was the third leading cause of death in the U.S. before COVID came?
I see no reason to entertain any questions by Artemis Fowl since they never answered my question about 30 million
They did pay me
undocumented.
$10, so
I know they did, but until they actually back up their bogus claim of 30 million in the 1990s of undocumented immigrants, I see no reason to answer anything or take anything that they say seriously.
He should give us $5 and tell us the answer.
Yeah, it was. I'm pretty sure that prior to COVID, that the third cause of death was I think what they're getting at was probably opiates or something along those lines. At least if it wasn't, that's believable to me. Sure, that's fine. The other side of what your name's Chris, right?
Me?
Corey?
Corey. I'm super bad with names. I'm sorry.
That's okay.
The other side of what you're talking about with the antibiotic resistant thing, I had a bacterial infection in my chest. I had an upper respiratory infection that was bacterial, and my doctor refused to give me antibiotics. The nurse came in and said, well, he's giving you, it was like either Tylenol or ibuprofen. I said, wait, why am I not getting antibiotics if I have bacterial infection? And she said the doctor doesn't like to prescribe antibiotics because of bacterial resistant, or antibiotic resistant bacteria. I'm like, wait. So I can't get treated because he's afraid of like this is bullshit. I was like, I want to talk to my doctor. If it's a virus, I agree. That shit's crazy. In some cases, if somebody has a really aggressive upper respiratory infection from viruses, antibiotics are given to help prevent bacterial infections from forming from the damage that that can be caused by that. This does make sense, but I think that what you're talking about does happen. But the other side of the coin is that sometimes doctors get paranoid, and then asthmatic people like me don't end up getting antibiotics when it's like, this is the treatment. Like, what are you doing? I have to be
Oh, wait,
miserable because you're afraid.
it's a no-win situation. Yeah,
Yeah,
I don't
and
know.
this is sort of the dichotomy that I see with medication culture in general. There's some people that see people that have had such bad experience with medication, or they just have this idea in their head of what medication means to be on it. And I think that we all just need to take a quick dose of reality and say that medication exists for a reason. There's some people that need it. If you want to have your doctor explain to you why it's getting prescribed, make sure it makes sense to you. Make sure that you get a good understanding of it. But it shouldn't be coming from this feeling that you have that medication is bad.
Well, it's not medication is bad. We have an idea that the only reason this medicine really exists is so that pharmaceutical companies can make money off of it. So it's the people that are making and giving us the medicine that are bad.
The only
not
reason
the
any product
person.
in the entire world exists is because people want to make money off of it. But that doesn't change the
Yeah.
utility that exists in the product within. Cars exist because people make money. You don't go, well, should I really trust my vehicle? Like, the only reason that they're trying to market a vehicle to me is so that they can make money. But
People
is
don't
it
like
going to get me
medicine
where
as
I'm
a product.
going?
We don't like
Yeah,
seeing
because
medicine
of
as a product.
right, because of that feeling that we have. That's what I'm speaking
Well,
to.
Well, because the people who are selling us things can be just lying to us to sell us shit, which they have
okay.
done. So it's like, why would we
Every
like?
product ever, though.
Well,
That's what I'm
without
Yes,
saying.
but
getting
this is medicine. There's
without
a
getting too off
difference.
topic,
I'm not addicted to my car.
but so yeah, seeing medicines as a consumer product, I'm wondering again. This is maybe too tangential, but I think it begs the question of like, how do you feel about pharmaceutical advertising? Because the United States is one of the only countries in the world where it's legal. I think New Zealand is the only other one
I don't like
where
it.
you're allowed to market pharmaceuticals. And maybe that's one of the reasons why medications are overprescribed.
They
It's
shouldn't be
because
for
like
profit.
since it's consumer driven, and if you see a commercial, well, don't the commercials very often say like ask your doctor about this? So like, isn't that pretty much just like consumer based medicine?
Yeah, and I'll be the first one to say I agree. We should have universal health care. We should have the ability to negotiate with drug companies to reduce medical costs for people since we don't have it. We don't have a lot of things that could help reduce all of these things. So we live in the world that we live in. That does not mean that we have to go around thinking that all pharmaceutical companies are going to give us something that's going to kill us. We have to understand that there are situations that really our lives might actually depend on taking preventative medicines. I have asthma. I have to take medication to control that. If I didn't trust the pharmaceutical industry to like the insane degree that some people do, I'm dead. Okay, I don't take my controller medicines. I don't have a rescue inhaler. I'm going to die, like the
Can you be
worst kind of
addicted to your
death.
inhaler? If you can be addicted to your inhaler, sure. People are usually skeptical, specifically of drugs that they have to be on for long
I
term
kind of am.
that they can't get off. You're not addicted to it. You
Well,
need it. There's a
so here's the
difference.
thing. If I realize that I'm far away from home, if I can't get home in like 2 hours or less, and I realize I don't have an inhaler, that can cause me to have a panic attack that will trigger an asthma attack. It's like the only way that I can freak myself out into having an asthma attack.
Yeah, but that's not because of withdrawal. That's because you're panicking that you
That
don't
well,
have
that's
it,
why
that
I
you're
said
worried.
kind
That's a
of.
completely that's
Yeah.
why I'm saying no, because like the flip side is I'm addicted to benzos, I'm addicted to Vicodin, I'm addicted to these drugs. I have to get larger doses because I'm not now tolerant to the lower dose that I'm taking. I then get onto heroin. This is like these are the issues. It's not so much that like every medication is bad. Most people aren't skeptical of inhalers. They're skeptical of things that they can be addicted to or SSRIs that they have to be on long term, and that is known that you can't just get off an SSRI. You have to wean off the SSRI.
How would you feel
So it's
about
just like
people getting prescribed addictive medications being required to take therapy alongside their treatment with addictive substances? Because one of the
therapy first.
highest associations with addiction is psychological issues.
Therapy first. I want you to see a therapist twice before you get put on any medications.
Okay, and
Because the
then
likely,
and
because the
ongoing while
like,
you're taking it.
because what's going to happen? Yeah, sure. What's going to happen is what happened with me, which is I'm going in for panic attacks. I'm not going in for depression. You give me this thing that helps me not have panic attacks anymore. all right, cool. So I can just figure this out on my own if that's the case. I have this thing that helps. Oh, well, I stopped going to the doctor. Now I'm just going to urgent cares, telling them while I'm having panic attacks, they're prescribing me benzos. Now you take it from them. Yes,
Shit.
this is how people do it. Yes.
You're good.
And then,
You got benzos from an urgent care? You're a fucking
regularly.
wizard, dog. Oh my god.
Regularly. Go in while you're having a panic attack. It's the best.
Okay. In the
Don't
meantime,
do that. Don't do that.
Don't do it.
20
But that's what happens. It's what happens, and then you have this long line of addiction. So I agree that it's the patient is also the problem. Like, I'm not saying the patient isn't the problem, but that's kind of like the issue with like the culture of therapy, like having therapy culture, is that patients feel like they can treat themselves because they've looked it up. My therapist is going to take 2 months to see me. Fuck them.
I mean, we're really ignoring the real problem here, right? And it's TikTok. Everybody sits on TikTok and gets convinced. Oh, is that the next? Yeah,
we'll
dude,
get to that.
I hate it so much.
Here we go. $20 from Artemis Fowl to say, thanks for poisoning the well, Corey. I have an opinion on a topic. Has nothing to do with the current topic. Many studies linked third highest cause of death in the U.S. is medical malpractice, not just pills. Wick has them now.
They poison the well themselves by
pills. No, I don't have pills. I'm not on drugs. But $5 from Testicle Johnson to say, have all the people pushing medicine tried going for a run and eating kale?
Yeah, I went for a run earlier today and consumed some kale.
Wait, who said that?
That was Artemis Fowl for the third highest cause of death comment, and then $5 from Testicle Johnson for the kale comment.
Testicle Johnson. Fuck you, dude. I used to be in good shape, and yeah, it helped, all right? I can't run. My fat ass has asthma.
Back to the issue at hand, right? Back to the issue at hand. Let's talk about both the, for lack of a better term, social contagion when it comes to ADHD, bipolar, dissociative disorder, et cetera, all these diagnoses, as well as the quote unquote medical malpractice and the state of the industry and how many bad actors there are within the industry. So let's tackle the contagion bit first. First of all, anyone want to push back on that there's a social contagion when it comes to these things? Or
I don't know about social contagion, but I would say, like, absolutely on social media there's a flood of poor quality or just straight misinformation, disinformation, that especially on TikTok. Like, I'm gonna post a study in the Discord chat of like half the information, at least based off of this study, like about ADHD, is just like whatever, basically just straight misinformation, disinformation. But that is that's what seems to be the most popular on TikTok. As in the study I'm going to link, they're like the medical professionals that are on social media that are giving accurate information, like they're getting the accurate information, but like it's not getting traction, as opposed to the poor quality information, the disinformation. That's what tends to go viral.
It's the people going.
Well, I think for very often, like they don't provide, let's say, a causal explanation in this study. But I think as sort of what we're
use your guess. Like, what's your instinct here?
Yeah, confirmation bias of like instead of I guess being challenged getting the accurate information, like they're going to hear the message that appeals to them the most, and that might be like the disinformation. Well, same thing with like any sort of conspiratorial thinking or largely speaking inaccurate thinking.
Wait, are you really
confirmation?
Are you really thinking about it? Because like let's be real, it's marketing, right? People on TikTok, they're already where people are looking. They're already people that people like, and then when they say this stuff, their minds are open. They're not shut off. When somebody sees somebody saying, "Hey, there's something wrong," and it conflicts with what they say, you have to be likable. People that put out studies and talk about things, like medical professionals that talk about things in a medical setting, it's not sexy, it's not funny, it's not entertaining, so people are shut out from it. That's why some of the best movers and shakers in our society are like comedians. Comedians that talk about political issues are really great at getting unpopular ideas out to the public because they're funny while they're doing it. Medical professionals fucking suck. People that do research fucking suck at talking to the masses because they're boring nerds. Who wants to listen to a boring nerd?
that's
So my
almost certainly true
podcasts
as
about
well.
therapy are probably way more popular than therapists, and probably if you have a streamer who considers themselves a counselor, probably like Dr. K is probably more popular. Like people are more likely to watch Dr. K than they are to go find their own therapist, and they'll just take the treatments from Dr. K that he gives to
You're
other
right.
people.
I think Dr. K is I think he's not a good person, and I still watch his stuff
Well,
because it's interesting. Like, look, I
I
don't want to
don't.
get into it. We'll be here all day. I'm just saying that like I'm susceptible to the entertainment factor of it. I want to hear why Asmongold thinks that he is incapable of cleaning his house.
And
That's
if you relate to
interesting.
Asmongold, and now he's doing that therapy session with Dr. K, you feel like you're doing that therapy session with Dr. K, and now you're good.
Yeah, especially if you've never had therapy. These kinds of things make people think that this is what therapy is. And that's super dangerous because then you go to see a therapist, like, hey, this isn't like that episode of Dr. K that I just
Oh,
saw
so
that
we
motivated
agree.
me to come
Therapy
here.
culture bad.
Yeah. Well, so there's both sides. There's like when we say therapy culture, medication culture, all these things, there's a culture and there's a counterculture. And I think they're both fucking stupid. We need
Well,
to
no,
meet somewhere in the middle.
there's like medicine, and then there's the culture around medicine. There's no counterculture. There's no counter medicine culture. It's just like there's what it actually is. So
I don't know
there's
about that.
therapy.
There
There's
is.
There's
definitely
therapy.
counter
There's
medicine.
therapy. There's
I think
therapy.
I've
and then
addressed
there's
these
a therapy
things.
culture. So like therapy is the counterculture.
What do you want to call the other movement that's super like so there's the therapy culture so super blindly for therapy that everybody needs to go. If he's not going to therapy, he's a red flag. Oh my god, keep him away from me. But then there's the other people who are like, nobody fucking needs therapy. You're just really being a little bitch about it, all right? This is a counter
Okay.
cultural
Sorry,
idea
yeah, okay.
to this. And then the medication thing too.
My bad.
Somebody who's like
Yeah.
well, like I'm not exactly the way that I imagine myself in my head, so obviously I'm not on enough pills. This is the far
I
extreme of that. And
misunderstood
somebody
what
who
you meant,
says
yeah.
you know what, like really I don't need any fucking medicine. I'm not weak, okay? I'm not a
I
little bitch.
misunderstood. I
Yeah.
misunderstood. Sorry. Yeah.
Yeah, and I think both of these sides are absolutely batshit crazy. We just need to be rational, and we need to guard ourselves from being super susceptible to people that are trying to convince us of things like TikTok. I can't tell you how many people have messaged me like, you know, I think I might be autistic. Like, why? What the fuck? And they're like, well, I seen like a bunch of these TikToks. I'm like, that's me. And it's really weird because some of these things are really there's some of them are done in a really good way to where I've shown people some of these ADHD ones that help them understand me a bit better. I was like, oh my god, I wish I would have thought to explain this in this way.
I've seen
This
that
is
guy.
such
I
a
know what you're
human
talking
way
about.
to explain why I'm why I do this thing that drives my wife crazy, and I can show it to her. She's like, oh, I get it. And that's really helped her understanding of like some of the stuff that I've gone through. But then again, too, I'm also somebody who's been diagnosed like by every single psychological professional that I've ever been for. Like, you have ADHD. Like,
I don't
yeah,
think
no
there's anything
shit.
wrong with. I don't think there's anything wrong with sharing your experiences, and I think I've seen that same guy on TikTok who does the ADHD, who he talks about like how he's dealt, what he deals with his ADHD, and like kind of like a story type.
Oh, I've
way.
seen a couple of
Yeah.
people that I thought they do this in a really good way. They're not sort of like pitching ADHD as a
Yeah.
product to get people to subscribe
Exactly.
to, but a lot of
I
them
think it's
do.
okay.
This is it is a social contagion.
What
It's
do
a
we,
mental poison.
What do we
If
think about the people who are? I'm trying to think of a good term for them, but let me kind of bear with me as I try to explain this correctly. People who will pitch their disability as not a disability. Well, there's nothing actually wrong with having X, Y, or Z. It's just thinking differently. We're the same as you, right?
autism is a superpower.
Yes,
Dude.
that kind of thing. I don't even know what to call it, right? Like, do they have a point though?
Delusional.
Like, is the stigma, right, that we give to people who have these conditions, right? Is it something that we should be combating by viewing the autism as a superpower, for example,
No,
or do you think that's counterproductive? What do we think, Dan?
I think the idea is that they just don't want to feel less human. So like you hear this from like blind people and like deaf people that what if they don't want to fix their deafness? They don't think there's anything wrong with them being deaf, right? So it's just I think it's a way to be like, this is an ailment I have, but it doesn't make me less human. I don't know if I want to fight against it necessarily, but like I don't think people should see like, oh, autism is a superpower either.
I think what you said sounds kind of slick, but it's not. It can't be that it might be a response to feeling less human, but nobody's saying they're less human. When they say
Yeah.
that I don't want to fix it because there's nothing wrong with me, what they're saying is that I have built an identity around something that is wrong with me. And
Okay.
also, I probably like some of the benefits that I get from having this disability, the way that people do see me as lesser, because people are going to be more willing to help me out. And all that. There has to be an incentive for you to want to keep that, because you're off the incentive for getting rid of your deafness is you can fucking hear. That's a huge thing. Like if you lost your if you lost your eyesight or your ability to hear, tell me you wouldn't do anything to get that back.
Well, I think it
What if you were
depends.
born not able to see or hear? It's kind of more what I was.
Yeah,
maybe
this
talking
is a
about,
topic on
but
a previous I think you were there, Ali. Like, and there's a difference between someone like losing their sight and obviously maybe having a strong desire to restore it, as opposed to someone like I'm pretty sure you were there, Ali. Of like, this is a topic of like genetic engineering, and like certain individuals that have lost their sight, not wanting to correct that with genetic engineering, where they have a
That's
desire
mental
for their
illness.
well, yeah, without getting too sidetracked, but like that was the question basically in this panel of like there are some people that for whatever reason, probably through congenital defect, have lost their sight, and then they have a strong desire for their children to also be blind. Now, like, there's obviously a question there.
You should. Well, that is a question. If you have a pill, right, that could cure blindness, autism, ADHD, all these, right, in the womb, right? Like you can make the woman take it, and she would take it, and it would guarantee that her child would have none of these things, right? Do you think that it should be mandated that people take these? Mandated, yes.
no, available for all and not just the rich, but not mandated. I don't know.
Why not? Why would we allow someone to be a drain on the system like that for when we could fix it?
I would say yes, but just so that I could know that I'm making decisions about women's bodies and they can't do anything to stop me about it. No, let's be real here. Anybody who's saying no is because they're one of the people that are insane, that are like, well, I just don't trust the pill. Like, we have the data. I'm assuming that there's like we have the data on this pill and everything.
Yeah,
right?
in this
So that-
hypothetical, it's perfectly safe. There are no other side effects. All it does is cure ADHD, autism, blindness, deafness, any congenital kind of
yeah, you go
issue,
look, you
right? Heart
QAnon
issue.
fucking freak.
Makes you healthy.
I'm gonna
You don't get to
quote,
abuse
I'm gonna
your
quote
child.
Admiral Gibbs and say it just sounds like a pretty slippery slope. When if you start with that, I don't know where we get to like, oh, what if you can
A slippery slope into what? A better society where these things don't exist? Oh no, we might slip into productivity and not being dragged down by preventable disease. What's next? Telling people that they need to get their children vaccinated to go to public schools?
I don't want my kid to deal with racism, so I'm gonna make them white.
That's the example that I brought. I think you were there. You're using my examples.
I don't know if we were on the same panel.
What if you're in the government, right? And you're in a position where you could put this in the water like fluorine. No one would know, right? At least not at first. And you could do that. Would you push that button to the anti-autism water? Would you let it flow, or would you forbear?
I probably, I don't know for sure, but I probably would not push that button.
Yeah, I probably wouldn't push the button. I like us just kind of we'll figure it out.
Wait, what about curing
Push the
cancer?
button.
If you had something where it would cure cancer and make sure no one ever got cancer, they wouldn't have a choice. You would just push a button, and through the water, the anti-cancer would come into the water. Would you push that button?
Even then, like,
No?
Jesus
what are
Christ.
you doing?
I'm-
What
I
is
am-
going on?
You're a
What is-
super
what are you
villain.
doing?
I am coming from
chill.
the. Like, can I
Yeah.
can I get out my position?
Yeah.
I'm coming from the position of like the way I view it is like forcing a medical treatment on a person without them knowing. Of like so you're using a water example, okay, and that sort of like dilutes. I
fluoride,
think for
like
me,
fluoride in the water. Yeah, that's why I'm
Yeah,
using
sure.
the example, because we do
But-
that in America with fluoride.
yeah,
right?
sure. So to bring it back down to like the example that you're giving of like, okay, at an individual level, this is genetic engineering, okay, and that like now you want to correct whatever
No, it's medical
defect
prevention.
that you see.
It's just medical prevention at this point. It's just a
Yeah,
pill.
yeah, it's okay. So
Wait, should
whatever.
Superman be in jail for rescuing
Okay,
people
can
who
I finish
didn't?
my
I'm
point,
just
please?
asking a clarifying question here to see where you're at. Does Superman have to go to jail because maybe these people wanted to be mugged or shot? Is it just because we're in the field of like the realm of medicine that you can't force the obvious best choice onto somebody? I don't understand. This is what I need clarification on. Is there something sacred about medical
Okay.
field?
If you're yeah, I think there is.
Okay.
So the, there might be a fundamental disagreement. That's why I'm going to try to use the example to tease out where our boundaries lie. Of like, okay, this genetic engineering technology is like now whatever the next 5-10 years, okay? And we're using the blindness example, okay? And through genetic screening, okay, they find out that the child that they're carrying is going to be blind, but we have the technology to correct it. Would you force that treatment on that this pregnant person or on the fetus? Okay,
Yes.
and
We already don't do that.
I would say
wouldn't.
somebody
So, like,
who
Jehovah's
isn't willing to
Witnesses who
take
can't
it
blood
is unfit to
transfusion-
be a mother.
Jehovah's Witnesses who don't
Well,
have
that's a
blood
separate
transfusions,
question.
can't force
Okay,
a
and
treatment
that might be
onto them.
valid. But like, yeah, I would not like strap them down, even if it's a pill. I would not like force feed that pill to them. I would not put it in their IV, whatever way it is.
Sure. Then here's the choice. You take this pill where we cure your child of these preventable diseases, you fucking psychopath, or you take the abortion pill. Pick one. Because this one, if you don't take this one, this means you're not taking care of your child already. It's not even here and you're abusing the
See that
fuck out of
slippery
it.
slope? that slope we were talking about?
so
Yeah,
yeah,
that slippery
that
slope upwards.
That's a fundamental disagreement of like I would not force the medical treatment on it, just as I wouldn't force the fluoridated water unknowingly on the population. So that's why I
Fluoridated
want
water,
to-
I'm with you. I think that the fluoride water, like, the potential downside, this pill was said to have no downsides. Fluoridated water has negative side effects.
Sure.
What about blood
But in a
transfusions for
hypothetical,
Jehovah's
this
Witnesses then?
drug has no side effect, right? No
like-
No,
negatives.
for Jehovah's Witnesses, let them ignore every medical technology that exists. Let them die out in obscurity. They're like, if you're a whole group of people that are going to deny these things, then like the problem's going to solve itself, right?
Okay. Well, I'm not a fan of any religion whatsoever, but like I'm not.
Well, no, I'm just saying, like, in terms of like forcing medical treatments onto people or onto people's kids, Jehovah's Witnesses don't believe they can't do blood transfusions and will deny blood transfusions or anything in regards to that. I'm not sure how they are on vaccines or anything like that. But I know the blood transfusion thing, and so like you want to force it onto them or just exclude them because you don't like them.
I think people's religious views when it comes to medicine get accepted up to a certain point. If somebody's child gets shot and they say, hey, you can't give my kid blood transfusion, get this mother out of here. We're giving the kid a blood transfusion. I don't give a fuck. A mom is not allowed on religious grounds to say, kill my kid. If a doctor is going to ignore their Hippocratic oath and watch this kid bleed out because they're not respecting their mother's religious beliefs, this doctor is committing a crime. Okay? They're letting a child die. And I don't care what the law says. I'm saying it's a crime. It's a crime against humanity. Okay?
This is going to like get into abortion of like, where does like, so that's why, the genetic engineering and like, genetically modifying a zygote, okay, versus genetically modifying like, where personhood begins for some people. Like, I'm on the same page as you of like, bad parents exist. I'm like, if a parent is denying a life-saving treatment for their child, even in the form of blood transfusion, like, and I think there are a couple of few documented cases in Canada of like, the courts have stepped in saying, hey, you cannot deny this blood transfusion to your child on the grounds of being a Jehovah's Witness. But for me, it's different since I don't view a zygote as a person. And so like for me, the mother, consent of the mother or the actual person that I recognize is more important there.
All I'm saying is that if there was a button I could push, and everyone in the world, whether they be in the womb or out of the womb, right? Whether they be old or young, whether they want it or not, would be no longer blind. I'm pushing that button. I'm slapping it as soon as I can. Boom, boom,
so
boom,
brave.
boom.
So brave.
Same with cancer, right? If I could push a button and make sure that everyone who currently has cancer, whether they want to be cured or not, I'm pushing the button. I'm slapping that shit.
Cancer
Why would
patients
you
are
not?
canceling
Why
you
would you
tomorrow.
allow, right, suffering, right, and someone to needlessly, especially with a child, right? A child who has no, like, they don't know, right? They don't know what it is. right? They don't know what they're doing. If you can make it so that they don't have to go through a life debilitating illness, right? One that will keep them not in the same way as race will, right? That's a real thing, but it's a different scope, right? A different scope of disability, right? And I don't even know if I want to use the word
That was the way
disability
that
there,
was
so
weird. Yeah.
yeah, don't know if I want to use the word disability there, right? But a different scope of a debilitation. Let's say that. Yeah, blindness ain't the same as being white or black. It's just not. Let's not play pretend here.
Just interestingly though, saying the pill to make them white so they wouldn't suffer racism is kind of goofy. What if you could press a button and make everybody some new race so to eliminate racism? It's not, nobody's white, nobody's black, no Chinese, Asian, Mexican, none of this. It's just a totally new thing, and we're all the same. Boom, no more racism. Does that change the hypothetical? Because I feel like saying white makes it like ridiculously unnecessarily
So,
charged.
the thing with the hypothetical is that, like, in the hypothetical, everything is going to work perfectly. What ends up happening if you actually allow, like, the genetic modification is you get Elysium, which was, like, that ring around Earth where all the rich people lived
Oh,
and
I
all the
saw that
broke
movie. That's a
people,
good
all
movie.
the broke people there. So the rich people had a machine, they could wake up, they'd lie in this bed, it would reconfigure their fucking DNA, and they wouldn't have anything anymore, right? That's what actually ends up happening. So, like, in your hypothetical where everyone in the world gets the same treatment, we all don't have cancer, and we all live in utopia, based, I'm with you. But we know that's what I mean by slippery slope. It's just that's not how that shit goes. And so, like, that's why I'm opposed to it. Like, not because I'm like an evil person who wants people to be blind.
Elysium's a metaphor for what actually exists right now, though. And also, when it comes to genetic modification, we live in an insanely genetically modified society. We eat bananas that were genetically modified as fuck so that they're edible to us. Like, most of our food is genetically modified in some way.
And now we're not allowed to, like,
Or at
just grow them because
chemically
Monsanto
modified.
owns. Yeah, and now Monsanto owns the seeds, and we can't grow the
You can
the
still
good
get
bananas.
heritage seeds if you want to.
I mean, but eventually we get to a point where we can't.
Okay.
That's the slope, right? That's
Okay. I know some of you have to go at 8.
Mhm.
And I know some people want in on this discussion. So how about we do this? I'll give you guys closing statements, and then I'll open it up for call-ins. And if you have thoughts on this, right, on either therapy culture or curing blindness.
Yeah, I was gonna say, you want closing statements on eugenics or therapy culture? Because we covered a lot of ground here.
I know.
Oh my god.
I think we're because I think we're sticking on the eugenics thing because this idea that, like, if your kid had cancer or your kid had blindness, if your kid was blind, there's any world where you wouldn't, if you could just make them take a pill to not be blind anymore, that you would. Yeah, that's wild to me. Anyway, closing statements. Go ahead, Corey, and we'll go around and we'll.
You closing statements on both? Okay.
Well, whatever you want to do, man. Your choice.
Okay. Yeah. Well, I think we just briefly touched upon, the genetics and anatomical, but yeah, I think there's a very interesting, well, maybe potentially interesting conversation to be had there. But yeah, eugenics, complicated. I don't think really people fully understand the implications of, let's say, how it will work somewhere down the line. But to return to the topic of therapy culture, yeah, I think pretty much it can be hopefully nicely summed up of, like, yeah, we covered a lot of the negatives of some of the negatives of, like, this increased pervasiveness of therapy culture. I think that there's valid criticisms there, but I think overall a net good, just as, like, raising awareness and, like, to the example that was brought up of, like, social media and the social contagion. I agree that might be an issue, but then I think it needs to be balanced out of, like, well, what if this increased awareness is, like, allowing people to get diagnosed where they actually need the valid diagnosis, like, it's bringing to their attention of, okay, maybe I should actually be screened for this, and now they're getting the actual appropriate treatment. So, cost-benefit analysis, like, yeah, there might be people that are, like, taking on the label or trying to diagnose themselves with these conditions unnecessarily, but then at the same time, I'm sure there's some group of people that are like, oh, I'm now aware of this, and I'm actually getting appropriate treatment, and hopefully my quality of life is improving. But yeah, this is great, as always. Super appreciate it. You can find me on Twitch, Corey Campbell 84, Twitter, X, Instagram, YouTube. It's Corey Campbell. Always a pleasure, Wick.
Well, I always like having you. Thank you for coming on. I really appreciate the discussion, and hopefully in the call-ins it's equally robust. This was fun. Elder Drowsy, go ahead.
I think that saying eugenics calling this stuff eugenics really only serves to remind people of like the Holocaust and stuff. It freaks people out, but at the end of the day, eugenics isn't necessarily a super bad thing. There's things that we do that eliminate traits all the time. Like there's just obviously good things that we can do to benefit society, and if we're not going to do them because we use scary words, stop using the fucking scary words to talk about them. Let's just deal with the reality of the situation. Same thing with the different cultural aspects of therapy, with medicine. People are just being either way too invested or way too freaked out, and we all need to step back and actually look at what we're talking about and stop being so fucking full of ourselves and thinking that we know everything all the time, I think, and just take a realistic, philanthropic approach to these issues. And I think the world would be a better place for it.
Where can people find you?
Elder Drazi on YouTube, on Twitch, Kick, and Twitter. And I'm streaming a lot now. We had a lot of people showing up. It's been really fun. You should check it out.
Do so, gang. Elder Drives, he's great. Even when I substantively disagree with him, he's fun to talk to. Go check him out, gang. Hit that like button, hit that subscribe button on his channel. He's great. Last but certainly not least, Ali, go ahead.
Yeah. Cultures are about vibes, not facts. So it's like fine to have cultures, but like don't take your information from them. Most of you need therapy. A lot of you don't. So just go with that. Stop looking up definitions for words and just using them because it helps you project whatever insecurities you have onto the world. It's not helping. It's not good. If you think everyone needs therapy, just you go to therapy and you'll find someone who's in therapy and everything will be okay. But other than that, I changed the name. It's sociologic_Ali's because Arab names are hard to say in English and look up. So that one's easier. They're all white words. So enjoy that. And thanks for having me on, Wick. I really appreciate it.
White words. No, thank you. Sociologic Ali. Check him out, gang. He's great. We love to have him. And gang, if you want part of this discussion, we're opening it up. So if you want to be in this discussion, if you have thoughts on apparently eugenics, or curing cancer and whether or not we should cure cancer, call in, !Discord, click the link, accept the rules, jump backstage. I'll pull you in and we'll have a discussion about it. But that's I want to hear the argument against curing blindness or deafness even.
Well,
I'm just really curious.
So I can't speak for that community, but that's why it's like I don't know.
Don't worry,
sure.
They can't hear you, right? Like the deaf community, at least they won't hear you. You're good. Continue.
But I think if you asked every single deaf or blind person on the planet saying, "Hey, do you want to cure your blindness? Tomorrow with this no side effect treatment," I think there will be a subpopulation that would say no. They would reject it.
You think that's a mental? You don't think that that's a sign of severe mental illness?
No.
I'm not qualified to make that.
I asked what you think. I didn't ask you to make a diagnosis. I said, what do you think? You had to take a guess.
No, I don't think it's a mental illness. If someone doesn't want to have their sight restored, their hearing restored, like I would respect that choice. I would not make
therapy.
Sure, that's also possible.
Just teasing.
Yeah.
But what about their kid? I understand for an adult. Like I understand for like someone who's like 40 years old or 30 years old even. But if a child, right? If it's for their child, they're having a child. We know 100% that they are going to be born blind. Okay? They're going to be born blind. We don't even have to do an invasive procedure, right? We could just, here's a pill, take the pill, your child will no longer be blind. Nothing else will change about them. They'll no longer be blind. You would not mandate that?
Make it less invasive. It's an aromatherapy candle that will cure their blindness. They don't even have to ingest anything.
More now.
Yeah. Even if it's an aromatherapy, like if you're saying that you just sneak it in, to me that doesn't make it any better.
No. They have to consent still. I'm not trying to take that part away from Wick's thing. I'm just saying they don't have to take a pill, a super scary pill.
I'm going to side with Corey on this. There's a concept called informed consent, and the child should have informed consent.
The child isn't born yet. The child.
I understand, but some people still believe that that child should choose things for itself. Because otherwise, the argument would not meet up well with abortion advocates, and saying that, well, we should think of the child. Well, the child isn't really an entity, so why should we care about it? It doesn't work right.
We're assuming the child's going to be born, though.
Yeah, well,
Like who cares if this child's going to be born if it's going to get aborted? That's not a relevant
Okay, so
objection.
if we're going to care about the child while it's in the womb, we got to like believe that it is an entity in and of itself that should be fixed.
We're only caring about the child in the womb in this scenario insofar as understanding that it is going to be born. It is going to be a human being that is going to end up being blind. So to prevent that, Wick has proposed a pill or maybe an aromatherapy candle that you don't even have to take. You can just smell it, and this child isn't going to be born blind. So what you're saying isn't compatible here. It doesn't matter how you feel about an embryo. We're treating the child just in advance.
So to be clear, I would say you should give it the medication, because why the fuck would you allow a child to be born blind?
Yes.
Well, yeah, that's the question.
Wait, can I ask
there's a informed consent argument, but you shouldn't just like inflict a preventable ailment upon a child. I don't know why I would even want that. Go ahead. Sorry.
So let's just say, I don't know if this actually will ever happen, but let's say we get these technologies that are all at home, of like at home testing, okay? And then as soon as as soon as conception happens, you can answer the question of like through genetic screening, pretty much from day one, will my child, be born blind? And then now we have plan B. Would you then, if they do that at home testing, and they answer yes, through genetic screening, this zygote will develop into a blind child, is it then mandated that they must take plan B?
So that'd be a Gattaca argument.
Abortion? Are you talking about plan B like an abortion, or is plan
Yeah,
B
well, like the next step of plan B of like, yeah, I can just expel the zygote pretty much like overnight.
That's a fundamentally different thing. And no,
to be fair, people with Planned Parenthood do this anyways if they're expecting a male or female. They can,
totally.
They do that nowadays. They for arbitrary reasons.
Okay, I am pro-choice, but I think it's immoral, right? To choose for arbitrary reasons to abort your child.
But I know where Corey's getting the argument from. There is a older movie called Gattaca that you can watch.
Yeah.
Where it's screen. It is. I love the TV screens being in a hyper advanced civilization, but their screens are all shit.
Look, don't worry about it. Like,
it comes down to is it for the good of society versus is it for the good of the personal choice of that person in removing their free will? Well, that is what it's coming down to.
In Gattaca, one of the issues that they had were people refusing to treat their child, and so their child ended up having a less good life, right?
Oh no! In Gattaca, they were just saying, well, you can give a birth normally, and you'll have these defects, or you can screen out all of the possible fertilized eggs to have a perfect child that has 6 fingers on each hand that could be playing a piano marvelously.
Yeah. Either go through the treatment that would help you or not, right? And it's been a while since I saw the movie, so maybe I'm getting a little
pretty old from the 90s, I think.
Right? Yeah. Right. But the question here is to Corey's hypothetical. There's a fundamental difference between curing someone's blindness with a pill versus aborting them with a pill, right? It's not the same. Like this idea that this child would not be the same child if they weren't blind, I think is fundamentally flawed. They would have different experiences, certainly, but they would nothing about their fundamental self would change.
Yeah,
here's the test. If we wouldn't cure something, and if somebody were to inflict upon themselves the ailment, if almost everybody would say they must be stopped, well, I don't respect your personal opinion about this. If somebody's going to blind themselves, almost everybody would say you're not allowed to do that. Somebody should step in and stop you. If you're in a situation where if you inflict that upon yourself, everybody almost is going to say we should stop you from doing it, then yes, we can force the prevention onto you. We can force the cure onto you. I think that's the best metric to go by.
So, okay. Just then further clarify your position, Wick, so I can modify my hypothetical of like, yeah, they have the still the at-home genetic screening. They can answer it, pretty much from day one, whether this child, let's say, will be blind, to use your example. But instead of plan B, they now have right next to them in pill form, the corrective, genetic therapy.
Yes.
So like, yeah, if this is all at home, like from day one, so once they answer that question, yes, through genetic screening of like, yes, this child will be born blind if it continues to develop, they are mandated to take the therapy then, right then and there.
Yeah. As long as there's assuming no
Yeah.
side effects, yeah.
Yeah,
Yeah.
okay. That is a fundamental difference. I would not mandate it. Oh, like, yeah, you're now obligated to take this pill.
So would you let someone take a pill that purposely blinded their child in the womb if they wanted?
Yeah, that's why I think this genetic engineering, I guess to use the less charged language that Eldrazi wants, is a really tricky thing of like, yeah, customized babies. To use the example again that Ali brought of like modifying skin color. Like, I don't know how to answer that question of like, if
Well,
someone wants, there totally would be, I'm sure,
They
a
were
subset
look,
of
they're
people.
deaf. Their parents were deaf. They have a very strong connection to
Yeah.
being deaf and
Mhm.
looking
Yeah,
and
this is literally a panel topic. Yeah.
hearing
Yeah.
the word, right? Uh, hearing the world through the ears of a deaf person, right? Like being deaf. And so their child, they screen it, it's not going to be deaf, but they want their child to be deaf, right? So they're going to take a pill, non-invasive, no other side effects. The child will also be deaf. You would allow that?
That's why I'm not in favor of genetic engineering. I would not
So
allow.
to be clear, you would say no. You would not allow a parent to take a pill that purposely made their child deaf.
Probably not.
Okay.
So would you also not allow them to take the pill to cure those diseases? Like, I understand you not wanting to force them.
I would make it permissible. That's the difference.
Okay,
Like,
then
I
you're
would not
full of
make
shit. Your premise isn't I'm against genetic engineering. Like,
Yeah,
you can't use that on
absolutely,
one
yes.
end and then say that it's okay if they choose it. You're fine with genetic engineering. It's just that
think
when
it's
we're trying to force
mandating
them and you think it's bad, like, then you can call on it, but like, you're actually okay with the thing.
He's against compelled.
He's against mandating. Yeah.
Yeah, he's against
against
compulsion. That's one of the. It's
his
an
whole
argument.
argument.
It's a liberal argument. The state shouldn't force you upon you to do something that like a medical intervention.
Like, okay, so like, okay, something my
To be
brothers
clear,
brought up.
I'll let you go in a second, Ali. But to clarify a little bit, Artemis, we're not talking about doing it for themselves or to themselves. We're talking about doing it to their child.
See, the
or
answer
allowing
is
it to
that
happen
the
to
so-
same argument that was stated with My Body, My Choice is going to come into play here, where you cannot force a woman to make a medical procedure against their will. That was the whole premise
just
of My
to
Body, My
just
Choice.
to catch. I'll get you in a second. Just to catch.
I don't believe
Arena
I
up.
don't believe in that.
Our
but-
conversation has transitioned
Mhm.
to apparently, would you force a woman to take a pill? Say the woman finds out that their child's going to be born deaf or blind. Would you force or mandate that woman take a pill? No other side effects. All it would do was make sure that the baby was going to be born able to see and able to hear.
No.
No. Okay, well that's the discussion. Go
What
ahead,
if it was?
Ollie.
What if it's a
Wait,
candle
so-
you just
wait,
had a sniff? This gets rid of the stupid my
what
body,
if-
my choice thing.
All
It
right,
gets
what
rid
about-
of
what about in a
saying it's
world-
against my diet.
What about in a world where Neuralink has been implemented? People have Neuralink. Your baby, you could choose to give your baby Neuralink because it'll have it'll be with the advantaged people versus just having like what would you say that needs to be mandated
No.
because we have Neuralink?
Nope.
Why? Wouldn't it be the same thing? You're having
No, not at all.
it's a debilitated
Because
life
in
with
one
less
case-
advantage.
In one case, what you're doing is you're either in the case of people taking the pills to make their baby deaf, versus people taking pills to or refusing to take a pill to cure the deafness of their baby. What you're doing is you're putting your child at a substantive back step from the norm, that the baseline, right?
Mhm.
A Neuralink is an improvement,
Yeah, what
right?
if that
It's
becomes
a,
the
it's a
baseline?
jump
Neuralink-
forward from the
What
baseline.
if that becomes
There's
the
a substantive
baseline?
difference here.
Everybody
What
that
if that
gets
becomes
Neuralink
the
chooses
baseline
to
and your
get it
kid-
though. Here's the
I
thing.
know, but if
There's
it-
a choice to
if
be
it
made
bec-
to get it. That's the
I know.
difference here. Is that
But
you can
in a
say I'm going
world
to choose to
where-
do this, and I want
Right.
this thing in my brain. Whereas nobody, if somebody says, I'm going to choose to blind myself, you'd go, the fuck you are. Somebody grab him, hold him down.
Yeah,
Let's get him
there's
to
an
the fucking
improvement.
nut house.
I
There's
wanna
something wrong
step
with
in
this
on this
guy.
What I'm saying is, if there's a baseline, if everyone, if it became that the majority of people were on Neuralink and you were at a disadvantage if you weren't on it, and there are people who were against it because they were just anti-technology and anti-advancement in these types of ways, right? Your argument is saying that these people should be mandated to have their kids eventually Neuralinked because that is the baseline, that is the norm, and you're putting your child at a disadvantage.
I think we have to leave it up to those people to have that argument because they're going to have different minds than us and they're going to have different values, different culture, and they'll be able to think things through differently.
So no mandate. So that's
Okay,
it.
hold on,
The
I got
problem is
a
no
question.
I'm
mandate.
saying
here.
we can't discuss this in a meaningful way because
Why?
it's just because we're talking about how people are going to think and discuss things are going to be significantly different because their brains are improved with computer technology. They're going to have a better understanding of all these things than we will, and that's going to be a much different world than this world.
Yeah,
There's an easier way.
Okay, a few people went in here. I want to give people a chance to say unfollowable
Sorry.
foul. I'm going to toss the
We
ball
have
to
way
you
too many
first.
fouls here in this.
We have
Discord.
a lot of fouls. Okay, infallible foul gets the ball first. Then we're going to the arena, and then we're going to go to Artemis foul. That's the order we're going to go in. Infallible foul. Go ahead.
Well, there's a lot easier way to look at this. If you look at babies that come out and they need to be on a breathing machine, you get to choose whether to put them on that or not.
The parents do, I believe. Oh well.
No, they don't.
You can say,
Well,
no,
yeah. Well,
they
well,
can breathe on their own. It's fine.
If it's life saving, yeah, like yes. If it's life saving, sorry, I want to clarify. Yeah, I understand life saving. Well, yeah, this is gonna go. When does personhood begin? So
To
We
be
talk
clear,
about
Corey,
slippery
you're
slopes.
correct. It is the parents' choice. They have many examples of the baby has a very small chance of living, especially ones that are born way premature, and they are put on those breathing machines. But the parents do have it during those gray areas of having the choice of whether or not to put the baby through suffering if it's not guaranteed they're going to live.
Yes, but there's a
that's
gray
just-
area there. It might or might not work. That's a different story than what we're asking.
Sure.
Is this definitely going to work? There are definitely not going to be side effects if you don't do this. This person is going to be disabled, right? And in the sense they were going to be unable to see and unable to hear for the rest of their life, and we cannot reverse that.
Sure.
Right? We have a limited period of time. We have to make this decision, right?
Mhm.
And to choose not to do that, to choose
Yeah.
not to cure your child is immoral, it is wrong, and it, dare I say, selfish and evil.
So how do you force them to do it?
I was going to say, I think having children is inherently selfish. I do think that that would be an immoral choice, but we have a right to, I don't think legally mandating it is ethical. I do think it would be immoral not to take the pill, but I also think that the government coming in and telling us what to do with our own genetic material is more of a problem than that.
Oh shit, Tuna Chip is
personally.
here. My bad. I didn't expect the antinatalist take. Wixray, everybody who's saying no to this, you're literally like a supervillain without the power. I don't fucking understand. Like, Corey, your world, like, I don't understand how you can make these claims and then say it's not okay for somebody to beat the shit out of their kid. Like, this is the
I have
craziest world
very
you're
strong
constructing.
stances on corporal punishment.
But okay, so
Very-
are you saying if there's a world where you can have, let's say you can snap your fingers, and instead of an abortion, a woman's fetus gets put into an artificial womb incubator and becomes a ward of the state, is that what we prefer?
That's
'Cause for me,
significant. That's significantly more complicated because now people can make the argument. See, this is why I even went with the candle. We're getting rid of the unnecessary, crazy arguments that come up. When it becomes a ward of the state, you go, okay, well then, what does that mean? How do I feel about the government raising a child or making the decisions for the child? Could the government do all like it's just a bunch of extra nonsense? But like, what if?
No. I think they're highlighting the forced medical intervention of like if we now have the technology, access to technology of like at any stage of pregnancy from conception to birth.
The implications are different here, though.
So
I think the
But either
ability
way, you're
for
told what to do with your genetic material before you've birthed. And as somebody who has the potential to give birth, I would very much like for there not to be government mandates telling me what to do with my uterus and my genetic material.
In this specific instance, it is your baby is objectively safer, healthier, better by every metric. And there's the assumption in this hypothetical that you are choosing to have the baby. So
I
there
think
is
Ali's
only
race, skin
upsides.
color arguments fits all
Well,
that
my
criteria.
Neuralink argument fits as well. It's just the same. It's the same thing. If the people you're putting your baby at a disadvantage if they're not. If they're, like the rest of the world is like it's a choice. It's the same
No.
exact thing.
The WIC example is objectively better. Making the baby a
Sure.
ward of the state brings in new variables that are not that they change this
They
objectivity.
have the best life ever. It doesn't matter. That's not the point. The point is specifically that there is now legal mandates telling you what you can and can't do with your
What
own
is the
genetics.
best- what is the best life?
If somebody steals somebody's sperm, I believe that to be a reproductive violation. If somebody steals somebody's eggs, or like that doctor that like used his own sperm in IVF or whatever, that is a reproductive, or maybe even like a sexual assault. I don't know if that would be accurate.
Sure,
but it's a
maybe none of
reproductive
this is the
assault.
same though. This is
But it is, because you are being told to change your genetic material, yes, for objectively better. But I've also heard some
we're talking about
disability
saving
activists say
a
that
child's health.
that their lives are worth living as nature intended. So there's also that
So
way to look at it.
If you know your baby is going to be born with 4
Nature doesn't
arms, no
intend
eyes.
anything. No,
and-
hold on, real quick.
Well, I would
let's
abort at that
address
point.
this. There is no intention. Like, nature isn't alive, right? It doesn't have a will. It doesn't have a
A
decision-making
metaphorical
capability.
intention.
There is no intention here, right? So again, like if I'm not advocating that these people be killed, that would be horrific. What I'm advocating for is that if it ever came into play where we could put this in the water, right? Where we could just put like fluoride, right? And so pregnant women who drink the water, whether they know it or not, right, their babies will be healthy. They won't have blindness, they won't have deafness, and these things will be cured. I think that's something we should do as a society.
What if the medication was, or the thing that was
If it's got side effects,
imperceptible?
then
Hold on.
That's
What if
what
it's
Neuralink is. Neuralink is just putting
on.
it in the water. It's the same thing. Your baby
hold-
won't be
hold
blind.
on.
They won't be sick. They'll be smarter. They'll be better. It's just putting all the benefits in the water. Versus
You're
just
assuming
the
too much about
blindness.
Neuralink. You
Okay,
didn't build out your
It's
hypothetical well enough.
hypothetical.
You didn't build
Hold
it out good enough.
It's not like.
Hold on.
Jeez.
What if you had an imperceptible, undetectable, like has no negative side effects, and it makes you non-religious, non-racist, agreeable, charitable, all the good things in life? Would you force it upon everybody?
no, that's a substantively different thing.
Yeah, that's too.
Why?
That's you're
Because-
interacting with way more values.
Yeah, like
Well, we're
talking
still
about
in the we're still in the
ability
magical
to
realm
perceive
of
the world,
betterment
right, as
here.
a baseline can, right?
Mhm.
So the baseline of being able to see or being
Mhm.
able to hear in these
Okay.
cases, right? That is a fundamentally different thing than changing someone's thoughts,
Yes.
which is what would
Well,
be
they never had
for
any
anti-racism or anti any of these things, right?
They
That's
didn't
a
have
very
thoughts to begin
different
with.
thing.
They never had thoughts to begin with.
You're just preventing those thoughts from ever occurring.
Yeah, that's a
Well-
fundamentally different thing than making sure that someone has the capability of seeing and hearing.
Wait,
Mhm.
what's
Thoughts and these ways of thinking are a fundamentally different concept than the senses.
The things that you're talking about are values that have reasonable conflicts and disagreements with people that are pro and against it. We would say that anybody who is pro blindness is fucking crazy. Like anybody who
how-
says I want a blind child, you go, there's 99% of people go, no, you should not be
But
able to take steps to
the-
make your child blind.
Do you
This
know
is
about
wrong.
the deaf
But
community?
they're
Like as a culture, like deaf culture,
This was
they very much
literally the panel
view.
topic.
Yeah.
Yeah.
Oh,
people develop a deaf culture out of necessity of being deaf and needing
but they're also anti-cochlear implants.
yeah, sure.
So
That's
they-
fine.
because they
Yeah, they're
argue
wrong
that
for that,
their
though. Like, that's the
culture
thing.
is
Yes.
So
That
keeping.
culture
That's a code.
is wrong.
So here's my big issue, right? For the thing that can cure blindness and the thing that can make you a better person, there is no argument you can make for one to give the power to the state to cure blindness or any medical issue and not have the power also be given to the state to fix all the other stuff. You're just giving the power to the state
Yes,
to
there
choose
is.
what is like what.
What you're talking about is, can we fix something that everybody agrees is a problem? Blindness,
Racism
Not everyone
is a
does.
deafness.
problem.
Like that is a
No,
not
we
everyone
don't.
does.
Not everybody agrees that racism is a problem. Some people are like, there are fucking different. There's race realists out there. You can't just say that. This is something that if humanity doesn't fix on its own, they're just going to substitute race, or they're just going to substitute some other difference to
Okay.
focus their lizard
okay,
brain
okay.
rage on.
Can I?
These
I'll
are
address-
idealistic
I will. I will.
things.
Okay, sure. I will address. So, hot take. I am against racism. Okay, but let's just say it boiled
What?
down.
Whoa.
Brave.
Let's just
Careful,
say.
TLS, brother.
Let's just say it boiled down like we
Whoa.
found the racist gene. Okay.
Mhm.
Okay, and so you can screen of like, am I gonna have a racist child?
Yep.
Would you mandate that genetic therapy? Because I would not, personally.
Good.
No, I
Anybody
don't
wanna
think it
answer
fixes
that?
yeah, I don't think it fixes the problem. I think
Okay.
that racism is generally going to be something that
It did fix
if
the
you take
problem.
it,
But
if you take it away,
hypothetically, if it did, would
Okay.
you?
That's
see,
what.
here's this is what I'm trying to say though. It'll fix the
But
problem
you
of
just said
it'll fix the
because-
problem of racism, but there's no part of my understanding of how this works that it's not going to then just map onto something different.
Okay, good. So
It's
now
something
we
that
have this.
has to be fixed at a broader societal level. I do not believe
Mm-hmm.
that there's a genetic component that could
can-
just be
can say-
changed for
You
it.
can say the same. You can almost say the same thing about blindness or deafness. We can accommodate
No,
them.
you
We have the
can't.
technology. You
I'm
can.
sa-
We can't.
I'm saying that you can fix blindness, and all of the problems associated with blindness go away when you fix it.
Okay.
There is nothing that we need to do as a society that would be better than just saying, "Hey, you can see now." This would
so here-
objectively be better. There's no negative side effect that happens from having sight that we'd say, blindness is
curious. I'm curious, Wick. You don't have to answer, but would you mandate the correction, the genetic correction for racism if it was rooted in genes?
If there were no negative side effects and it just got rid of racism as we understand it to be in a negative sense, yes, obviously.
That's
So
fine.
here-
Yeah, I would not.
I don't
here's-
agree
here's-
with you building it out that
But
way, by the way.
This is a problem here, and let me kind of clarify here. I don't think that like racism is a gene, but
No, I'm
blindness,
not, I don't think it
is.
is either. Like, but
right?
So
And that's
here's
the difference here. Blindness and deafness are
Mhm.
something that is in our genes that we could hopefully, right, one day
Okay.
fix.
So-
Right? Racism isn't that.
so here's
Okay,
my
well,
here's
so
my
that's sorry. I'll let you go, Iron.
Yeah,
but
go
that
ahead.
directly speaks to Eldridge because he's comparing blindness to racism. Everyone agrees.
I'm
that
not.
blindness is bad. But why did you bring up racism to begin with? Of like,
Somebody
hold-
else's hypothetical.
I did. Yeah,
okay,
it's my
then I
hypothetical.
apologize. I
Yeah,
apologize.
right.
I retract everything.
Okay. So
Okay,
I'm
Good.
gonna
Good.
bring,
Total
so I'm
wick
gonna
victory. Anyway, go on, Artemis.
I'm gonna. This is the culmination point where I was dragging everybody here too. So, if that's the case, where a certifiable medical issue is there, blindness, let's just say schizophrenia, stuff like that, you can identify it in the womb. Okay. Or a value of racism, whatever, like mental value that you would have as you were an adult. It could be cured on either way. Which one does trans identity fall into? And would you fix it?
I wouldn't fix it because I don't care if people want to be trans.
But that's a medical issue. That is a thing that can be cured medically, right?
No, saying something can be cured medically doesn't necessarily make it a medical issue. If you said we could give everybody a pill and they're no longer into anime, I wouldn't call this a medical issue.
But
Hold on,
Hang on,
Jenny,
hang on.
go ahead.
One breath say I would give you a pill
Oh,
to
your
cure
mic
blind.
is just not working.
so
Can
I-
people hear her?
no,
I know
no.
it's cutting out.
So
severely.
to be clear, everybody's
that's
everybody should be in
unfortunate.
agreement that being trans is a genetic issue, right?
I don't think
No,
that's how it works. No.
no.
It could
it's
be. I
not.
don't know. I
If
I
it's
just
not-
don't know enough about
So,
it.
so what causes it?
Wait, we're conflating purely physiological things with things that are now
Mhm.
entering into the realm of ideas and emotionality and values, all coming together to create an effect. Being blind means my fucking eyes don't work. Full stop. That's all that it means. If I'm racist, there are layers and layers of different things that are creating this feeling in me, and then how I behave and externalize it has negative effects for people, sure. But my eyes not working, on, off. Ears not working, on, off. It's that simple. There's no downstream effect here that like causes all kinds of weird things and
Well,
that
now
we
I
don't
have to
fully
hear you,
understand. We
dumbass.
fully
That's a
understand.
downstream effect.
But schizophrenia is your brain not working, but you can hear and see things, right?
Well, I was addressing like the racism and all these things. I think schizophrenia
okay,
is a
wait,
much
wait.
more interesting thing to talk about.
Yeah,
To be
sure.
clear.
What about stupid? If you could
They-
hear stupid.
Yeah.
Yes, if I could put in the water where people would be more wise, smarter, just more intelligent overall. It wouldn't change like it wouldn't change what they ended up thinking, but it would improve their ability to do so. Yes, I would absolutely put that in the water. Why would I not?
If there was a glove that happened to be like jeweled, that has some stones in it, and you snap it, it will do the same effect. Would you snap it?
Would I snap it? I would Thanos snap that into existence. What I wouldn't do is Thanos snap stupid people out of existence. People who
So-
are currently like, who else would be on my panels, right? I wouldn't have no more guests.
Yeah,
if I had to get rid of. This is the difference here that we're talking about, right? I'm not talking about getting rid of anyone that currently exists. What I am doing is I'm saying that in the future, right? I want people to be better, to be smarter.
Isn't that saying you don't want them to exist?
Oh, I'm curious.
Eventually.
What's
You don't want
your
blind people to exist, so you want to eliminate blindness.
what's your IQ cutoff, Wick? I'm super curious. You wanna give
I
a
want better
numerical
wages for
value.
workers because I hate poor people. That's not how this works, okay?
Yeah, am I
there
genocide?
are-
Am I eugenicsing poorness out of existence by giving everyone a living wage?
There is a argument among that I've seen among the some of the disability activist communities
Yeah.
that selective abortion is ableist and that
Yep.
it is an act of genocide.
Correct.
So, but I still do believe that you have the right to
There is
getting
an
an abortion
argument
for
there,
whatever reason.
but it's
It-
not
it-
equivalent to what Wick's talking about.
But
Sort of.
you,
Sort of.
No,
So if you
they still get
so
to
if
be
you're-
born.
well,
Just
no. Yeah. So what if we had a pill that could magically turn trans people into into just normal people?
This is a style of
reject that
being.
language,
This is a
but okay.
flavor of existence here, okay? This is something
norm
that
it being the norm, right? It's a norm.
you're talking about altering somebody's identification, which is not the same as altering somebody's ability to access their senses so that they can
Well,
have an
Well,
identity
they
that's
don't have-
informed
they
by
don't
other
have
senses.
They don't have dysphoria anymore. They don't have the depression anymore. They don't have the debilitating ailments that
Yeah,
come with it.
it's
Not-
a medical
not-
thing.
Not everybody that is trans has gender dysphoria. Not everybody
weird.
who's trans
Wait.
hates themselves and is depressed. There's some people that are
Wait.
trans that absolutely love themselves. They have
I'm
no
just
gender
letting
dysphoria.
you guys know we have 5 minutes, and then I'm cutting this off because I want to go do some things.
I just wanted to point out that there was going to be a cognitive dissonance in the conversation with this topic. That's why I wanted to bring that up. But accomplishing my goal, I'm going to head out so that way you don't get your video taken
And
down.
remember to give me money as you
I
do so.
will.
But thank you, Artemis.
Don't back
I do
down, Corey.
appreciate your
Keep fighting.
I do appreciate your perspective. So thank you. Jenny, let's try your mic again.
Hi, Jenny.
Is this better?
Oh, just
A
quiet.
little bit, I think. Just it's a volume issue.
I'm gonna
Yeah, at
turn
this
her up.
point, hold on.
Okay. Is that better?
That
Yes,
seems much better.
go.
Yeah.
Okay. So my thing here is you guys are all coming from the point where all disabilities are inherently a burden, period, the end, nothing else. Nothing else.
Not
Stop
me.
shaking your head. Yes.
Not all of
Yes.
them. Blindness and deafness for sure, though.
Blindness and deafness. And they also have accommodations that normal people like you and me
Why do they need
can,
those?
can give to them.
Yeah,
Like,
but
you don't have to actually walk a blind person to the door. You can just get the fuck out of their way. That's a lot of the times what they need.
no, this
because
isn't
they
an
have-
argument about
they
what I have
usually
to do
have-
to accommodate them. It's about giving them the senses that they're missing.
Right.
It's not
But
about
here's the-
enriching
here's
my
the
life.
thing.
Their life is
At
better.
and this is something that I pointed out in the chat 3 times today. Stop screaming at me. 3 times today is at any time after birth. you can become disabled in any way. What are we going to do? Are we going to kill those people that become disabled? Because we aborted the people that were going to be born that way.
No, we
prevented it from
aborted.
happening.
The reason why I gave the abortion, if they didn't want to take the pill, is because this person is choosing to abuse their child. If somebody is going to say, I'm going to let my child be blinded, like if somebody says, I'm going to blind your kid right now, unless you stop me, like, yeah, I'm not going to stop you. They don't deserve to have a kid.
The thought exercise that we were having, that was the thought exercise that you guys were up here having, is
that's what I said.
Should we be able to cure it? Should we be able to cure it?
Should we force the cure?
And my argument was, at any time after birth, you can become disabled in a whole bunch of different ways.
Yeah, and it's a tragedy when it happens.
Some things are a lot worse than what you would have been born with.
Wait, so then what do we do with the people after? Okay, so we cured the blindness.
Exactly. So what do we do with the people after?
What do we do with the people that are blind after?
Everything we can to help and fix it.
If we can't cure that, no, let me answer this. If we can't cure that, right, we still have those accommodations because they need them, right? We can't cure
so
that.
What
If we could cure it, we should cure it.
What's the point in doing anything good if something bad can happen?
No one is dying, right? No one is going away.
What if the person who becomes disabled doesn't want the cure? Do we mandate the cure?
Yeah,
because then
we don't allow people to be a drain on the system unnecessarily.
If somebody wants to end their life, we don't let them do it.
Actually, in Canada,
we do it all the time.
we explicitly do.
People are ending their lives all the time. Whether it's
not because people are letting them.
You don't. That's wrong.
We call this a tragedy for a reason. Yes, if somebody is disabled after they're born, it's a tragedy. And if somebody could have stopped it and they didn't,
no, it's not. It's not always a tragedy. It is not always a tragedy.
We have an immense difference in values. Then, if my child becomes blind or deaf or in a wheelchair, I will love them and accept them, but it was a tragic thing that happened to my child.
I have 3 children with disabilities. I have one with dwarfism and 2 with autism. I wouldn't have cured any of them because every single thing that they've gone through in their every single thing that they've gone through because of what their disability is, it's not as bad. My disability was worse at birth. I was supposed to have died like 1,000 times before I turned 1. They kept telling me I was going to die. I wasn't able to physically run until I was 4 because every time I would go faster than a basic walk, my heart would hurt. As a baby.
I'm not invalidating any of the things that you say.
None of my kids have gone through this.
I don't understand.
I'm grateful for that.
I don't understand your argument.
They have their own disabilities.
I think the argument is that...
I would never have gotten rid of their disabilities. Never once.
Okay, I just want to make sure.
That...
Hold on, before you go,
sorry,
because I know people have to go. They have a heart out at 8. It is 8, and I want to give them that heart out. If you have to go, I understand. We love you. Thank you for coming. Thank you for enjoying this conversation with us, but I understand. So I know that Ali said he had to go, and Corey had to go. So
I got the same 5 minutes.
Oh, you guys got 5? Okay, well, then carry on. I was just trying to be like...
No, thank you. I appreciate it.
Respectful of your time, but...
Jenny, I have a quick hypothetical for you to show that, like, I think that you actually do agree with me. There is a switch that you have to push. You have to turn it left or you have to turn it right. Yeah, this is like the last thing I have to say. I know I've talked a bunch because I've been losing my goddamn mind this whole time. If you turn the switch left, every single human being that's ever born from here on out will be blind and autistic. And if you turn it right, nobody that's born after you flip that switch will ever be born or autistic ever again. And if you don't flip it, the entire world dies and so do all the animals and the sun envelops us all. So you got to pick one or the other. Which one do you pick?
This is literally the dumbest Charlie exercise because it doesn't actually give you a real explanation of what you're doing. You're just doing it either or.
Yes. I'm trying to see which one you think is better. There is a good answer. Not everybody being blind and autistic is better.
I think
I'm not saying I wouldn't prefer it if my oldest didn't have
Yeah, and that's what I'm saying. I'm not saying that they're
bad. Or if my other kids didn't have autism. I'm not saying I wouldn't prefer it. But they don't deserve to die because of it. And this entire last hour of you guys has been Eugenics 101.
I have not.
And it's frustrating. And it's frustrating to see people that I view as friends up here talking about this shit. And it's frightening.
I don't want anybody to die.
lives with disabilities are worth living, and those experiences are worth experiencing for people. And we have a variety of human experiences, and by eliminating that experience, you are homogenizing the human experience. And I think that many disability activists do talk about that, how they wouldn't
Exactly.
flip a switch
Like-
to not be disabled anymore because
I
they
don't
value
think-
that experience.
I don't think anybody here has talked about eugenics. I don't think anybody has really just said, they take
Before
a
you
pill
got on here,
and make the
Infallible.
person not exist. That's completely different.
Yeah, neither Wick nor
Yeah,
I said
I'm
kill
curious
these people.
who's
The problem
advocated
is
for
that's what it
killing?
sounds like. That's what it ends up sounding. That's why me and Corey were like, well, I mean, it just sounds like you're just
That's why I said we
eliminating-
shouldn't use the word eugenics, because it sounds
if
like
you-
that.
Well, anytime you're saying you
Talking
want to
about aborting or taking a pill or putting something in the water to get rid of certain disabilities, that is eugenics, you guys.
Yes,
It
it's
doesn't get rid
eugenics
of
in
the
a good
person.
way.
It doesn't get rid of the
No.
person. It get rid of the
Listen,
disability. Vaccines are eugenics, right? Vaccines
Well,
are
it's
a
the
form
same-
of eugenics.
Oh,
Okay,
Listen.
can I say it? Can
Oh
I
my-
say that's the same as saying therapy can be sitting down on a couch and talking to somebody. It can also be electric shocks, or it could be lobotomy. That's all therapy. So since it's all the same thing, we can't have therapy.
What?
Yeah, the line of reasoning that you're going down, Jenny, says that I shouldn't take my ADHD meds. I shouldn't be able to get antidepressants.
I'm not saying that at all.
But what if
You
it
should
eliminates?
use any
What if it
and
eliminates
all
my
accommodations
disability?
afforded to you. What I'm saying you should use any and all accommodations afforded to you and available to you. What I'm saying is that your life as someone with ADHD is no less than somebody without ADHD.
Sure, and if my mom
That's what I'm
chose to
saying.
if my mom could have prevented me from having it and she chose not to, fuck her. She abused me before I was even born.
How do you prevent someone from having it?
The hypothetical pill situation we were talking about. I would hate my
The
mother
whole
if
question,
she chose
if
this
I
for
may
me.
clarify, there's a pill that you can take, and if you take it, your child, who is still in your womb, will not be born blind, deaf, with any problems at all, right? Deafness and blindness are what we settled on, right? Deafness and blindness, it would cure them of it. They'd still be born. They'd still be your kid. They just wouldn't have those two disabilities, deafness and blindness. Would
Yes.
you take the pill? And my argument is anyone who would not take the pill is immoral.
I would take the pill. I just wouldn't want it legally mandated. That's
No,
the
I
question,
think
right? Legally mandating.
Yeah, I think that
I
it's,
think we can socially shame people. We could use that. We could encourage people, but I think legally mandating medical treatment is
well,
wrong.
we legally mandate that people can't purposely blind or deafen their kids.
Yeah.
Right? We
You
do
know,
that.
when
This
my
is just a small step in the further in the direction. I don't think it's a slippery slope. I think it's just a small step that's saying, hey, again, assuming no side effects in this hypothetical, assuming no cost, assuming there's literally no downside. All you have to do is take it. Okay. If you don't, I think there should be some legal penalties for that. Yeah.
when my kid was being born, my child wasn't getting enough oxygen, and my child's mother wouldn't keep the oxygen mask on her face because it was uncomfortable. She was ripping it off, and the doctor said, "Dad, you need to keep that mask on her face." And I put it up to her face. She'd get that fucking thing off me, and I said, "I can't." And I held it to her face to make sure that my child wasn't getting deprived of oxygen, because as a parent, I have a responsibility, and I don't care if the mother doesn't like it. My kid's coming first right now, and your feelings don't matter. Kid needs oxygen. If my kid's going to be born blind or deaf, Mom, you're taking the fucking pill. You don't get to make sure that you don't get to increase the odds of our kid being born deaf or blind. Or if we know it, you don't get to decide that they're going to be. Fuck that shit. I do the same thing as I do with the oxygen mask. Sorry you're uncomfortable.
But that's when I
Deal with
asked,
it.
what do we do? What do we do in life when people after birth are deafened and blinded?
We treat them as
Do
human
we,
beings.
tell
We
them?
care about them, and we help them every bit of the way that we can. Of course. And if there's a cure, we give them the cure. This is
All right.
we don't
so
say kill
what
them.
do we do with this? What do we do with this knowledge, knowing that absolutely no medication on the planet is 100% efficient in all
Piggy
humans?
Froggy style.
What do we do when it causes terrible side effects?
That's not part of the hypothetical.
If there
Well,
was
then
a
it's a dumb
hypothetical, it becomes
hypothetical.
a harder question. It becomes something we wouldn't mandate in that case, right? That if there's a
Yes.
possibility that, so in 80% chance that they will be cured entirely, but there's a 20% that something horrible will happen. No way we mandate that. None. Right?
Mandating utopia is easy though.
Yeah.
Like a mandated utopia is like that's an easy argument. Like obviously,
The
Well,
could
you
if I could
say
That's why I
talk you
asked
obviously,
into
but
you
we've
living in
been
guys.
arguing
utopia,
about
like
this
go
the whole
on.
time, right? Like people have been
Yeah.
arguing against
Right.
my utopia.
Jenny, the
right?
hypothetical is designed to
Well,
see where
because
people's values lay. It's a values test. Of course, it's super unrealistic that there's no side effects, but we're trying to see, do you take the obvious correct choice, or is there some weird shit you have going on in your head? You hold some weird
well,
value that says objectively better, healthier, more vibrant children is bad if I have to do something I don't feel like doing.
is that
That's
really
what we're
testing your
testing
values
for.
if the
I
if
I
the
would
alternative
see
is
it differently.
utopia?
Like my child deserves to be born as they are. The way I've always looked at it is my child deserves to be born as they are.
What if your child's going to be born as a
If
worm
Wait,
and they go, you can just take this pill and they'll have all their limbs and it'd be super chill? You'd be like, no, I'm going to take the worm baby.
yeah, I'm sorry, but
Fuck!
like
Okay,
my
okay.
child deserves to be born as they are, and
At this point,
unless it's a life threatening
This is a this is a
problem,
religious
I would
argument
change
now.
nothing.
You are religious about this.
okay.
Kind of.
Yeah.
Thank you, gang, for coming today. I really
Thank
appreciate
you.
you all for being here. This has been a great show. If you've enjoyed this content, thank you for the $5. Artemis Fowl. To say if we don't like people being a drain on the welfare system, boy, do I have some news for you. We'll discuss that later. Tomorrow, 6 p.m. Eastern, I have a call-in show with community member Small Peanut has asked to be my guest, so
Yay.
why not? I'll have her on, and we'll do a call-in. So call in tomorrow. Wednesday, we're going to be talking about canvassing. Thursday, we have some people on to debate on the Houthi strikes, the Houthi situation, and then Friday, gang, me and Destiny, the Omni-Liberal, will be teaming up, right, to combat Non-Smoker and Alistar the Great on the Houthi situation in general. It'll be a great debate. I'll be participating in the debate, not moderating, so that will be fun. So tune in.
What's your position?
6 p.m.
Who
7
is
p.m. Eastern
moderating?
on Friday, and that will be fun. I don't know, but it'll be. I don't know who the moderator is, but it'll be Non-Smoker and Alistair versus me and Destiny.
Where?
Tune
What
in.
chat?
1 p.m. Eastern. Huh?
On yours? On your
I'm gonna
TV?
stream it. Hell yeah!
Oh,
Tune
hell
in to
yeah.
me. I don't care about these
That's
other
the-
people. Tune in to me.
that's what we
But
wanna
anyway,
hear.
I wanted to give Arena a chance to shout herself out, tell people where they can find her, because she didn't get a chance because she was off doing things. So I'm gonna give her that chance. Then we're gonna end this. Go ahead, Arena.
Thank you so much. Sorry, I missed half the juicy panel. I was glad I was able to join for the last portion. You can find me on Arena Nana on YouTube and at monoshock.john on Instagram and TikTok. I make lifestyle, philosophy, and film analysis content. So a little bit of everything there for everybody.
What's your favorite movie, real quick?
Oh God, like of which genre? I have so many, but my favorite one I've seen recently is Saltburn. I
What's
did
your favorite
enjoy
movie you
that.
haven't
Saltburn was
seen?
good.
Saltburn.
was good.
Interesting. I'll let you guys go. We're rating out. We'll rate into Prime Kai. Make sure you let him know that this is a hate raid. But bye everyone. Bye.
Always a pleasure.
See ya.
Super great.
All right.
For the record,
now that the
Arena
cameras
is
are off,
already
how's
a
everyone doing?
sick
Did everyone
handle.
enjoy?
She already has a great handle.
This is true.
No, thanks for coming, gang. I think it was a good discussion. I hope
Wait,
you
what's
guys
your
enjoyed it.
position on the healthy thing? I want to know if I want to watch it or if I'm just gonna get
We
mad
gotta
at you.
go.
Oh, and are you gonna be
Yeah.
mad at me?
Peace out, guys.
Well, I wanted
see
to
you
know
later.
if I'm gonna be.
Sure. So I think that the Houthis are slavers and child soldier people, right? And if we can bomb them, we should.
I had some
Right.
content with that, though.
Just based on that.
Yeah, just based on that, like literally just based on that, I'm okay with it. But they're also attacking shipping lanes, right? They're also attacking civilian ships. Something needs to be done. So
Yeah, I'm of the position that if you attack anything in America's ship, you've been put on notice more than any. There's no international move you could make more that's been put on notice than attacking Americans' ships or anything of us in the water. We bomb you for it.
yeah, and that's good.
Yeah,
right?
yeah.
Like I want to live in a nation who will protect its people, right? And I think that, yeah, if you threaten its people,
Yeah, it's not even fuck around and
you get
find
what
out.
you get.
World War II, World War I, Vietnam, all because somebody fucked with our water shit. You know what's gonna happen.
One question,
it has
though.
to.
Go ahead, ask your question.
You were really moralizing at that point. and you're, the whole slave thing, and that's horrible that they enslave people, but you're saying the slaves were fighting the battles, so your idea would be
Kill
slavery is
slaves.
bad, so we should kill the slaves.
Well, they're bombing the
It's-
missile sites, right? They're bombing the radar sites as well.
I
In
mean,
fact, not a lot of Houthis are actually dying in these strikes,
yeah, I
right? They're
mean, to be
degrading their
honest,
ability to strike, which I'm fine with. Like, I wouldn't be fine with going in and like carpet bombing them. No, I'm not fine with that, right? But
like it's not an easy choice either. So there's no way to say that it's like really
eh,
easy to just say, well,
it's
yeah,
easy
we're,
for
we're
me.
killing slaves. Yeah, we probably are, but it's
I
not
don't.
as easy to go like, oh, they enslave people, so it's okay if we kill them all. It's like,
Well, I don't. Again, I
we're
want
killing
my
I don't think
slaves.
that's
Then.
what he
goal
said. I
here
don't
is
think that's
just.
what he said.
Yeah,
No,
I don't want to
I'm
genocide them.
just
Like,
pointing out that that's the way like some people could have taken it
oh, maybe,
the other day.
but I don't know what to tell them at that point, right?
So
Like,
I want to give you a chance to like maybe clarify that a little bit.
I'm sure
You're
that's
gonna
what
be
they're gonna
talking about
paint
it,
it
so
as on Friday. I'm sure that's what my opponents are gonna paint me as on Friday, but that's kind of the deal is I'm going to stop them from doing that. I'm gonna be like, no, I don't want them to like I don't want a ground invasion or anything like that. What Biden's doing is targeted military strikes to degrade their ability to fuck with our shipping. And I think that the only argument against that, right? The only argument against that is we should have done it sooner. Fair. Yeah, probably. But I don't know. That's my stance. That's what I think.
I mean,
Thanks for coming, Unfollowable
Iran was
File.
bombing us too, so I mean, it's not completely
Well,
like
no, Iran didn't
nothing but
strike us yet. Iran struck near us, which is different.
military targets. But
Yeah, but they weren't American military targets. They were
I thought they did.
others.
I had heard that. Well, maybe it's just
Yeah, that was initially it was reported that way, but it turned
okay.
out to be not true, right? They had struck near us, so it was a near an American military target, but it was a different target.
All right, thanks
But
for having me on.
yeah, of course. See you later. Drazi, you wanted to ask me something as well off screen?
Yeah. Well, I didn't stop streaming, but like, if you're okay still saying it while I'm streaming, because I was gonna do something else after this. It's nothing super touchy or anything. Is that okay?
Yeah. Hold on, give me a second.
Yeah, put your clothes back on.
What?
Yeah, they can still see you.
Oh. No. Okay. Sorry, I had to answer a DM real quick.
No worries. So I'm pretty sure that I'm gonna end up making a video. I'm working on a video right now that should be done by tomorrow, and after that, I want to make a video about all the claims people have made throughout Biden's career as president. Because it's really started off for me when people were blaming him for gas prices, and I'd say, "How? Explain this to me. How?" And I would get either nothing or the most delusional, like Charlie from Sunny with the fucking lines on the board explanation as to how he's causing gas prices to go up. And since then, I feel like it started there. It's just all the big criticisms are like fantastical or they're nonsense. And I just want to put them all in one spot so people can see like this is what people are actually mad about. When you get the feeling from the people that you're around that Biden sucks at his job, this is why. These are the reasons that people think that he's bad. Ask yourself, do you believe any of this? Is any of this even real? Maybe we can just criticize things that are actually real if we don't like them, and we don't have to invent reasons because that Biden might actually or Trump might actually win because of made up stuff about Biden, which is fucking insane.
I mean, this isn't new as a problem, right? Like people have always ascribed more agency to the president, or more like everything gets blamed on the president. Even like you remember that meme, "Thanks Obama," right? Thanks
Yeah.
Obama. Oh,
Yeah.
Thanks Obama.
But it
right?
didn't work on the left. This works on the left though. This is the new
Yeah,
thing.
I know this is silly. It's really is an artifact of them just really hating American foreign policy. And they will blame what Israel is doing on America, just wholesale, right? Or any of NATO on what like it gets pinned on America. For me, my issue with a lot of the criticism, both of the foreign policy and the domestic policy of Biden, is that they want a dictator. They want a benevolent king. They
They
don't
want the
want someone to
philosopher
work
king.
within the system. Yeah, they don't want someone that has to work within the system that's going to be messy. It's going to be chaotic. It's going to be democratic. What they want is someone to be just able to go in there and from on high dictate, right? What is we're going to do and what is not. And they want someone that dictates how they want things to run, right? So they want someone that agrees with them, that will dictate and make all their political wants a reality with no thought to the process behind it. I think that's faulty. I think that's something I'm 100% against. I would rather get none of my political stuff passed than elect a king that would do it
Yes.
all, right?
Yeah.
Because I don't want a king.
Right. The value in being able to have to choose at all, to have any kind of voice is the thing that really matters. I think the thing that I saw when I seen the left really stop making sense with Biden is when he stopped the the college tuition payments. And then he said,
Yes.
okay, they're going to start up now. And people on the left are like, he's a terrible president. I'm like, you
Yeah.
got so much of what you wanted, but because it's not exactly what you want, like you got more than anybody would have ever given you. And now he's a fucking bastard because he stopped giving you everything you wanted. This is insane to me. Like the left want the people on the far left want exactly what they want, how they want it, and when they want it. Nothing less or you're bad. And people on the right really just want to piss off people on the left. That seems like the main thing. So the people on the right seem easier to please than the people on the left are because you have to give them everything on the far left at least everything, and on the far right,
Well,
all you have to do is
the
take
right's
something
going through
away.
its own thing right now. Like, I know we don't see it as much because we don't have as many right people in our space, but there are their whole never Trumpers, Trump
Yeah,
issue. That's its own thing. What's happening now is it's moderates versus extremists in
Yes.
a very real sense. And on both sides,
yes,
we're having a quote unquote, not to be hyperbolic about it, a civil war, right? A lot of fractures, and they're fracturing along these lines. Are you okay with incremental moderate change? Or are you an extremist? I don't care if I can get 80% of what I want because I can't get 100% of what I want. You're a monster and I'm never going to support you again, right? It's well, did you see my little meme I made, right? Where it's a trolley problem, and
yeah,
it's like you could pull the lever and save 5 lives, but you wouldn't destroy Israel. Like, what should you do, right? Like, there's no other downside, only you don't destroy Israel. And by the way, even if you don't pull the lever, Israel still doesn't get destroyed, right?
yes.
Like, so
Yeah, that's a good
it's
representation of the thing that I'm talking about.
yeah.
I don't. It just feels like everybody. Politics are now pure emotion, no values, no thought, no ability to engage with reality whatsoever, none. And I don't know how we win when this is happening, because like I think I used to think I was pretty decently left, but like I'm center left. I'm pretty center left, I think. Because if you give me something that I want, I'm happy. I don't have to have everything that I want. If you had a president that stood for all the values that I stood for, but it turned out he did blackface in the 80s, I still like him as a president. He's still doing what I want him to do. I don't need him to be perfect. I don't need him to be the most outstanding person in the world. I just help us out.
A lot of people are one issue voters though, right? Let's keep that in mind too. Like for them, they don't this is their issue. They don't have any other issues. This is their issue, right? And I mean, that's an issue, right? That's what are you gonna do about that?
I think they're bad citizens then.
No, look, I agree, but they still get to vote,
Yeah,
and we
yeah.
still have to answer that and try to convince them, right? But like my argument to these people, look, between you and me, my hope is that Biden ends up winning even with these people all being like, oh, we'll never vote for Biden. So after he wins, we could say, oh, good. We can just ignore you entirely now, right? We could just cast you aside. That's my hope. So I don't have to deal with their annoying dumbasses, right? But more
Right now
likely,
they're scary.
right? Yeah, more likely, they are going to have some influence, and so I have to pretend to care what they think. So, yeah, that is what it is.
Yeah. I think that if people don't change their mind about this, Trump wins.
Yeah, well, I think it's far too soon to sell. We see Biden's approval numbers being like subpar, like underwater, 38%. But then we look at the state by state polling on who's winning, and that's much more of a mixed bag. And I think that as we get more into the election, where better news about the economy is coming daily, right? People are becoming more and more positive about the economy. I think that those kind of bread and butter table issues, middle America issues, are going to win the day. They may not like Biden, but people can't like people will. There's a sizable enough portion of the public that will say anyone but Trump that will vote for Biden. That I think that he's going to pull it out, but it's far too soon to say. Like we're 11 months out.
Yeah, I'm
Something's
just
gonna happen.
fearful.
Yeah. No, fearful is good, right? So.
Yeah. So just I guess over the next couple days, if you see anything, like if you see any of the strong criticism of Biden, if you could just shoot me a DM with them so that I can try to tackle them in this, like it's not gonna be like a huge project, like a 15-minute video. I'd like to address all of them and just investigate the claims and show that maybe they're not as bad or valid as people think. I would really appreciate it because I'm trying to figure it out, but I don't hear them all the time. They just happen a lot in passing.
Yeah, I think we swim in different circles than they do, right? So, but there is enough of them. The question is, because most of the time I hear them from, it's from online, it's from Twitter, it's from things like that, and I'm not sure how many of them are actually even American and can vote.
Oh,
Does
that's
that
a
make
really
sense?
good point.
Right?
Yeah.
Like there's a lot of Canadians or Europeans or things like that who say this shit and it gets boosted. And we think because we're Americans, right? We think everyone's American, right?
Yeah,
So we
yeah.
just yeah.
A
So
large portion of my
just
audience is
really
Australian and British, and like it
yeah,
always catches me off guard.
yeah. And so I don't know is the thing. I'm really curious how many of them are American. So because if they're not American, in this I don't give a shit, right? Like I don't.
Yeah.
Okay, cool. You don't like Biden. You ain't gonna vote for him or vote for Trump either way. Bye, right? Like this is our business. Let us handle our business.
I'm gonna
But
start asking.
yeah, like are you even American?
Yeah.
And find out.
Yeah, if you have no horse in
And
the
the
race, it's
second
easy to shit
question,
on whoever's in charge.
yeah, and the second question, have you voted in the last few elections? Right? Because a lot of them would say no too, right? Like it's a
It
thing where
doesn't
like,
matter
well,
if
you
I
weren't
vote.
voting anyway. Okay. Cool. Thanks for your opinion. Let's file it in the paper shredder, and no one cares about what you like. Here's the thing: if you don't vote, you don't matter, and this is just true. Why would they? Why would anyone try to win something you're not going to do? Like, why would they try to win your vote?
I guess that makes sense. Well, some people would say I don't matter because I voted for Gary Johnson in 2016, but I actually liked him. I thought he was the best candidate. I really did.
It is what it is, right? You repented, I hope, and are no longer voting for Gary Johnson in 2024. But we'll see.
Is he running?
I don't even know.
Oh.
But hey, I just think, like I said, there's a button you can push that it won't fix all your problems, but it will keep them from getting worse. And that button is voting for Biden.
Yeah, I agree. All
anyway,
right, man.
Thanks for talking to me. Always a pleasure.
Same.
I'll see you later. Bye.
Take it easy. Bye. Let me catch up on chat here. That'll be 2016 large portion. Well, I don't have that big of a fucking the community. I would say is the people that show up regularly. So I would say most of them aren't American. It seems like. I used to think Biden was far more progressive than I could have dreamed. I wish he had come down hard against fracking, though. I think that, like, if you're the president, I don't think that you can be like super, super, super progressive. I think that you have to like sort of pick the battles that you want to go super hard on because like most of the time your goal isn't going to be to alienate everybody on the other side. You're gonna hope to be able to bring some people over, even if that's just like a pipe dream. Like you can't you can't like rally the right against you. I don't think Wick said any. I don't think what Wick said about problems not getting worse maps onto reality. I think what he means to say is that if you don't want a substantive amount of problems to get worse, and by worse he means the way that they would become worse when Trump gets elected. You want this? These? Okay. Then you have to vote for Biden because I don't like. Let's be honest. If you're here, if you're watching me, you probably agree that Biden is better than Trump. You can not like Biden very much. You can think that he could be better in a lot of ways, but I think it's very hard to list the ways in which Trump is going to be better than Biden is. Oh, unless you think that better means owning the libs, in which case Trump's your guy, 100%. If all you care about is making people who are on the left feel bad, you'd be crazy not to vote for Trump. He's going to do it way, way more. We were never going to get the Green New Deal, but as a negotiating starting point, we got a lot of stuff through. It's a good way to address, yeah, in fact, it's a really good negotiation tactic to ask for a whole bunch of shit. Like you ask for everything that you want, and then it doesn't seem like such a big deal when you whittle it down. You're like, what if I just have these 3 things? I know I asked for like 40 things that are all like really big and crazy, but like, what if I just got 3 of these? It's a pretty good negotiation tactic. I'm not speaking to whether it's true or not, but I think that a large portion of Americans do not consider their circumstances better now than under Trump. And that is the reality. Yeah, that's why I want to make a video about the biggest complaints about Biden and investigate whether they're actually true or not. Because if they are true, then I think it's worth talking about. But if they're not true, I think it's worth examining and thoroughly going through why they're not true. Because like I've lived through Obama getting criticized for wearing a tan suit. Like this is unpresidential. He decided not to wear a flag pin on his lapel. How un-American! Every president has always worn a flag on their lapel during a speech. Like this kind of nonsense. He wore a helmet while he rode a bike. Like he's supposed to be our leader. He's and he's showing weakness in front of the entire world by wearing a helmet. At least all of these super dumb, nonsensical things that the right criticized for Obama for were real. They're things that actually happened, whether they mattered or not, whether it's a big deal or not, whether I think that's all complete ridiculous nonsense. That's just people wanting to bitch for the sake of bitching about him, is to the side of the fact that at least they happened. But with Biden, I feel like a lot of the criticisms of Biden that I've heard are completely fabricated, or they're based on something that doesn't end up connecting to the actual criticism at all. And this is a really bad problem for me. If you want to hold politicians accountable, if you want to say, hey, you've done this thing and I think it's wrong, just like the lapel or the helmet, any of that shit, if that bothers you and you want to complain about it, good, you should. This is America. He's supposed to represent you. Bitch about it. Let people know how you feel. I'm all for that. But if you have to make shit up about it, and then I think that maybe shut the fuck up. Like I'm not really supportive of people convincing other people of lies about somebody who's running things, because that's only going to serve to make things worse for us, right? Hold people accountable when they do things that are bad. Don't attempt to hold people accountable for things that aren't real. This is really, really, really like that. It just destroys any kind of confidence in the system. And like, not that I have the most confidence in the system, but we need some. We need to believe that. We need to at least be able to believe. Like, we need to be able to believe that when people are going after a politician, when they're being held accountable for something, if they have to respond to something, that at least this thing is real. Like, Biden didn't drive up gas prices. But if I believe that Biden is raising gas prices, then I should be fucking pissed off at him. Like when everything's as bad as it was and gas prices were like almost $6 a gallon where I'm at, like I am mad at this happening. And if somebody's choosing to do that, then I have a right to feel that way. But I need to direct that where it's supposed to go. I don't think that like any energy spent trying to hold a politician accountable for things that they're not doing is really good energy that's being misplaced because most politicians are doing things that they need to be held accountable for. Don't waste that. Don't waste that drive on made up bullshit. Use that drive on attacking politicians for fucking up for real. Go after the people that are actually doing shit that you hate. Become become an activist in that way. Don't become an activist in imaginary crimes. They're presumptively not tried. Trazer, you should do this. It's why I found Destiny through Vosh. Real talk with the Trazy and I like. Where does treatment be the one to do this good project? The Yemen stuff is complicated, and I had to double check that we weren't the bad guys. Spoiler: we weren't. Run for office. Use anger as energy. Anger is one of the most motivating emotions that we have. The Yemen stuff is complicated, which is why I have no real comment on our exact response. I don't know if what we did exactly is the best response for all that, but I do know that it's deserved in the respect that you know it's going to happen. If you attack our shit in the water, you are walking up like there's a contract sitting on the world stage. Anybody can walk up and sign it and say, I agree to have the United States attack us. All you have to do to sign that document is fuck with our shit in the water. And whether we should or shouldn't, I don't know. It can be too complicated. I don't have enough information to say whether this is a good thing or not, but I know that they came up and they signed that document. They agreed to that contract when they did it. This is always the case. If somebody's standing on their lawn with 2 guns in each hand and says, I'm going to shoot any motherfucker that steps on my lawn, and they're always, and they've killed celebrities for walking on their lawn. Like, everybody knows about it. Like, if they shot, like, Leonardo DiCaprio and Winston Churchill for stepping on their lawn, everybody knows, and the whole world, don't step on this motherfucker's lawn. You might be able to go, hey, I don't think that guy should be shooting people. But you can't go, hey, he shot that guy for stepping on his lawn. I can't believe that he did that. Like, that guy knew he was going to get shot. 100%. This is, like, you can't act like he didn't, like, that they weren't on notice. So it's very hard for me to say that, but like, I'm going to say that we had to do something. We've established this, system of protecting our stuff. And if we don't do it then I guess it's kind of an open invitation for anybody to fuck with our shit that's in the water. And that's been our most protected thing throughout history. If there's anything that I would be concerned about the U.S. showing weakness, it would probably be lapsing on that. Because you can't go to World War II, World War I, and Vietnam over this and then say we don't care anymore. Johnny Lydon, do you know the Sex Pistols? I'm aware of the Sex Pistols. Well, I think Wick made a really good point about a lot of these people not being American. I think from now on, when I see people criticizing the system, if I don't know who they are, I'm gonna ask them what country they're from, because it'll tell me how much I should care after the conversation's over with. That's the important part for me. Because, like, I can still care about the criticism. I can still engage with it just because, like, somebody's in my audience or whatever, and I'm going to give them the time of day just for being here. But I'm not going to care about it after the fact. I'm not going to think that this is a reflection of, like, our current political system or like, the systemic view that people have about the political system. So that's pretty valuable. I think that's it for now. I wanna work. There's a video that I'm making right now. I'm making a review of Animal Crossing: New Horizons, which is pretty out of left field, I know. But I got inspired to make it last night. I already wrote up the script, so I just got to record. I just got to read it off and record it, and then throw some clips in there, and then I can publish it. So I'm gonna spend some time on that. No, Saxon, I told you, I just need to know what's going on in advance. I went on this panel today because Wick got a hold of me in advance. If you're in there and I see you and I'm like, all right, I feel like VCing now, that's different. But like, I don't usually, like, I'm not really one to just like do things spur of the moment like that. I like to have some idea of what's going on and sort of plan things out. Well, I'm not talking about on stream. I'm just talking about in general how I am. Even when I'm like hanging out with friends and stuff. If somebody says like, "Hey, do you want to come over right now?" I always say no. I never want to come over right now. All right. Yeah. I'm almost certainly going to be streaming tomorrow. Going over the last little bit of the Mr. Girl, and Destiny thing. So, like the stream and all that. Let's see. Yeah, I know you only want to come over right now.